Good morning, everyone. I am Diane Allen. I am currently a school nurse specialist with the Department of Education. I work for Tracy White, and welcome to the Fundamentals of School Nursing 1.0. This is a very informal meeting that we will be doing today, and Becky Cooper will be co-presenting, and she'll be on in just a minute. But we wanted to let you know that we will have a break scheduled from 11 to 11:15. And then at 11:15 to 11:30, we're going to do a Q&A period. So put your questions in the chat room and we will try and get to those as many as questions. Otherwise, we will try and answer them later on too. We will also have another Q&A period at the end of the session at 1 to 1:15 as well too. And if the chat room gets totally overwhelmed, we'll try and answer your questions as they come up. Becky and I will be tag teaming. We do have our wonderful, wonderful person from Virginia Tech Leland who is going to be running the PowerPoint for us today. Unfortunately, we ran into some Zoom problems with, because there are so many links embedded that we try to, so we can take you to the places where a lot of this information is. And every time we click back out of the Zoom link, the additional links, it kicked us out of Zoom. So Leland is going to be running the PowerPoint for me. And so if you hear next a lot or click on the link, please, that's for him as well too. Anyway, again, we welcome you. And we really look forward to you in this session. And again, this is very, very laid back. And Becky, if you can tell them a little bit about yourself. This is Becky Cooper. Did we lose Becky? Okay. While we are trying to find Becky, I will tell you I am retired from Fairfax County School Health Program. I was the school health coordinator for a while, and I was also a nurse manager with 2 different school health teams. And again, right now I am a school nurse specialist working for school health for the Virginia Department of Education. So let's see if we can find Becky.
Diane, it appears that she may have been disconnected.
Okay, well, while Becky is doing that, and she'll come in just a minute, Becky is the school nurse coordinator for Shenandoah Public Schools. And she is in the middle of what I would call the firestorm right now because her schools open up next week. So she is a tremendous, tremendous asset. And we will pick her brains for everything right now. Next, please, Leland. Okay, we just have this disclosure statement, which we need to say is that both Becky and I disclose the absence of any personal financial relationship with commercial interests relevant to this educational activity within the past 12 months. I think a lot of people that there's absolutely no commercial interest because most of us haven't done a whole lot of things for the last 12 months too, but we have no financial ties to any statements or anything. All right. Okay, so Becky just said she is getting help right now. Her internet went down. Okay, next, please. And just to let you know, if those of you may have heard when we met in person at Longwood, this course was actually 2 days, 12 plus hours. We are splitting it up because number one, we didn't have the time, but basically we were throwing so much information at you all that it was just too much. So subsequent sessions will be presented in fall of 2021 and then early spring 2022 to get you a little bit more information. Next. the objectives, and I will read these. Basically, at the conclusion, you will be able to describe at least 3 school health entry requirements into Virginia public schools, be able to discuss plans for the opening of the school health room or school clinic, whatever you call it, be able to identify where to find at least 4 resources for school nurses. We aren't talking about that you can, right off the top of your head, identify the school nurses, but you need to be able to look where it triggers in your mind of, oh, okay, I can go look there. And be able to discuss how to do a vision and hearing screening. We are just going through that very, very briefly. Discuss at least 3 aspects of the role of the school nurse and the advantages of involvement in the school community. And we will, at the end, discuss that. As the more involved you are in your school, the more you're going to hear things, the more people are going to trust you, etc. And then be able to outline the process of identifying a student with special education needs. That is very important because, as we all know, some of the screening requests are going to start coming through just the first week of school, or even before you get back there, because a lot of IEPs and certainly 504s have been on hold for the actual meetings during the last year. They were because so many of the schools in the state were closed down for a good part of last year. Next. So, definition of school nursing. School nursing is a specialized practice of nursing that protects and promotes student health, facilitates optimal development, and advances academic success. School nurses, grounded in ethical and evidence-based practice, are the leaders who will bridge healthcare and education, provide care coordination, advocate for quality student-centered care, and collaborate to design systems that allow individuals and communities to develop their full potential. And this is taken directly from the National Association of School Nurses. So it's pretty overwhelming when you look at it. Those of you who are in possibly your 2nd or 3rd year, you realize what you bought into. A lot of people are coming directly from acute care, but here you have the entire student, and not just the student, you have their families, you have the school community, and you have their community as well too. Next. Becky, are you there? Oh, Becky's here.
Can you hear me?
Yes, can you hear me?
Can you see me? I can't see anyone but you.
I'm here.
Okay.
So while we're saying keep calm and think like a nurse, let me introduce you to Becky Cooper.
Hi, everyone. My name is Becky Cooper. I currently serve as the school nurse coordinator for Shenandoah County Public Schools, which is a division located up in the far northwest corner of the state. We're about 80 miles due west of DC. So we're just out of the whole Northern Virginia urban area. We are rural, a rural division for sure. And we have 10 schools in our division. We have 11 nurses in our division. And I have been, I'm a graduate of UVA many, many years ago. And I have been in school nursing or community health nursing in one way or another since 1976. So I've been around for a long time, and most all of my career has been in school health, which I love. And I'm glad you all are here today, and we hope that we can help you with some ideas and some thoughts and some perspective and some facts that will just give you a little more clarity as you try to navigate the field of school nursing, which is such a specialized subset. It takes years to get it under your belt and feel confident and sure in what you're doing. But like I say to our nurses every year, and this piece is this picture or these words that are on the screen right now, say it well. I tell them, you may not feel like it all the time, but remember, you are the medical expert in your building. There isn't anybody else in your building that knows more about medicine than you do. So take that and run with it. Be well educated, be well informed, be accurate, and be confident when you're talking about health as it relates to your students and also to the staff.
Okay, thank you, Becky. And
You
I
bet.
guess I should also say that I am also a UVA grad, and we probably should have dressed in blue and orange today, particularly since Two Who's medaled in swimming last night. So, but we thought,
you saw that. I didn't even get near TV.
yeah, they did. So that's exciting. All right, next, please. Before we all panic, because we know if you are brand new, yes, somebody else too. If you are brand new, we know how overwhelming this is too. And I should probably also say I did work 20 years of school health in Fairfax. So what we have here are, and if you wouldn't mind clicking on that first link, Leland. Tracy White and Joanna Pitts from the VDH have developed this entire Padlet, and we're going to refer to this a lot. This is amazing. She has put everything underneath here, and you can go down here and she loads lots of other stuff into it as we discover it. But as you can see, these are the Zoom meetings, the school nurse calendar, the videos, CISN. There are going to be a whole lot of things that are going to be loaded onto that, and then for certification for NCSN too. All right, if we can come back, please. And if Leland, if you wouldn't mind clicking on the next link. And this is another Padlet that we have developed, and this is new school nurse orientation. I'll probably be rearranging this as well too. But some of the big chunks that we are going to discuss in this one and the next one, we're going to have out here for you to be able to access it, just so you can go through it, anything else that you want to. All right. Thank you.
I will say, while we're moving that on, I remember when I first attending summer conference, which has been back in the year 2000, and I was so overwhelmed. I heard all these nurses talking about all the different things they were doing in their school, and I thought I was supposed to do all of that in my school. And it took me a while to realize you can't do it all. You pick and choose what applies and what works for your school division and what fits within the limits, the criteria that your school division functions under, and that's what you work with. So there may be information that we talk about today that just isn't going to work for you in your school because you're just not there yet. But it's something to maybe think about in the future. But don't feel like you have to incorporate all of this right away. It's just a lot of really good information and good resources for you as you continue to progress and learn more about school health.
That's right. And I would certainly second that too, because I know it can be very intimidating. Like, I need to start this, I need to do that, I'm not doing anything. And this is, take it bit by bit. You're just going to take one little bit, a little bite of school nursing at a time. Next, please. All right, let's get into some of the meat of this. And this is not necessarily the fun part, but this is something that always needs to be in the back of your mind. Delegation, which is the authorization of a registered nurse to an unlicensed person to perform selected nursing tasks and procedures in accordance with the Virginia Administrative Code and the Board of Nursing. Next. So here, and if you wouldn't mind clicking on that link, please, Leland, that is the criteria for delegation, and that's under Virginia law. If we can go back, please. And then again, under these specific laws as well too, an assessment is required by the nurse prior to delegation. And also it lists what tasks that may not be delegated. And those tasks are requiring a nursing assessment, triage, and administration of medications. And probably a lot of you are right now saying, wait a minute, what about the unlicensed people in the schools who administer medications? And that is the principal is in loco parentis. They are responsible for everybody in that school building. They're the ones who decide who is going to be the principal's designee to administer medications when you as the school nurse are not there. Okay, that is not under your license. All right. Things are different depending on the model for school health because there are many different models on the way it is done within the state and certainly across the nation.
And we'll talk more about that when we talk about trainings further on
Yes.
in this presentation.
Yes. Next, please. So what else does delegation require? In order to delegate something, it cannot require the exercise of independent nursing judgment. And this is where you've got to get back to your nursing process. It does not require complex observations or critical decisions with respect to that nursing task or procedure. It frequently recurs in the routine care of a client or a group of clients, and it does not require repeated performance of nursing assessments. So this is where I will just give you an example. Changing insulin pumps and things like that. Do you do it frequently? If it's not done routinely, then you're not going to delegate that to somebody else too. If it is a child that has, for instance, a catheterization that is done every single day, it doesn't require an assessment before you do it. It happens every single day, and it does not require a repeated performance of a nursing assessment. Then you can do it. Okay, next, please. It does utilize a standard procedure in which the tasks or procedures can be performed according to exact, unchanging directions and have predictable results, and for which the consequences of performing the task or procedures improperly are minimal and are not life-threatening. In the absence of delegation or training, the school system remains accountable to ensure the students' needs are met in accordance with both federal and state law. So if you have catheterization, blood sugar testing that you're doing every day or sometimes several times a day, you have a standard procedure. Usually you have step by step by step that somebody who is unlicensed can follow. Anything else you want to add, Becky? Okay. I know this is heavy stuff. So the 5 rights of delegation. The registered nurse is not required to delegate an unlicensed person to perform a nursing task if it does not meet the criteria from the Virginia Board of Nursing. Delegation shall be made only if all of the following criteria are met. So, for an example, if your principal says that he or she wants a student's classroom aide to be trained in a procedure, but you are not comfortable, you have trained this person and they just don't seem to get it. They just can't do it. You are uncomfortable doing it. You as a registered nurse can say, no, I am not delegating that to that person. But the school system and the school is responsible for making sure that there is somebody who can be delegated to perform that procedure. So then it is going to be on the principal to find somebody else too. But if you are uncomfortable that this person cannot do a step-by-step procedure and do it safely and do it correctly, then don't delegate it. Okay. Next, please. So number 1, in the judgment, medications, whether, and we will discuss that later, because remember, that's the principal designee. The question is, how does that relate to medications that are given on a field trip when the school nurse isn't there? We will address that later. So number 1, in the judgment of the delegating nurse, the task or procedure can be done properly and safely performed by that unlicensed person, and the delegation does not jeopardize the health, safety, and welfare of the client. substitute student for that. Number 2, the delegating nurse retains responsibility and accountability for nursing care of the client, including nursing assessment, planning, evaluation, documentation, and supervision. So that means if you are delegating, and I'm going to use a simple in and out path for that as an example, that you have done the assessment, you've done the planning, the step-by-step instructions, you've trained, you have evaluated, you've documented that this person is trained and that you have supervised them and you've seen them do it and you're comfortable with it, you can delegate. Next, please. Number 3 is the delegated tasks and procedures are within the knowledge area of responsibilities and skills of the delegating nurse, which basically means if you've never done that procedure or it's outside your practice, you can't delegate something that you don't know how to do. Number 4, the delegated tasks and procedures are communicated on a client or student specific basis to an unlicensed person with clear, specific instructions for performance of activities, potential complications, and expected results. Again, if you have a step-by-step procedure, standards of practice for that particular procedure, also included it should be if you see this, then this is what you're going to do. Contact the parents. If the urine, for instance, is cloudy or bloody or something. All right, next. Number 5, the person to whom a nursing task has been delegated is clearly identified to the client as an unlicensed person by a name tag worn while giving client care and by personal communication by the delegating nurse when necessary. So for instance, if you have a school health aide or clinic assistant, they must be identified that they are unlicensed. And this, because sometimes they refer to themselves or somebody refers to them as a nurse, which is practicing nursing without a license. But you as the delegating nurse need to make sure that the parents, the community are aware that this is an unlicensed person, maybe a teacher, a teacher's aide or something that is going to be doing this. Okay. Next, please. And again, the RN or LPN scope of practice. And this link, if you wouldn't mind hitting it, Leland. Okay, here you go. The decision-making model for determining the RN LPN scope of practice. And if you could scroll down to the next page. Here's the algorithm too. So basically it tells you if you follow it step by step, is this permitted? If you're not sure what you're supposed to do, if you are sure that it's prohibited, you don't do anything. So here's an algorithm. And yes, this is on the new school nurse orientation Padlet as well too. Okay, next please. Professional nursing insurance. A lot of people question about this. Do you have to have it? No. Do a lot of us have it? I believe so. I certainly have as well for professional liability and malpractice. And additionally, I have the NSO, Nursing Service Organization, and they do have a rider for consultation because you do talk to kids, their parents, and their staff. And just as a protection. So we have no financial claims or anything from them, but I know I carry personal liability insurance.
And it generally is fairly reasonable cost for the year.
I think mine is due and
it has a cap to it, but the cap is pretty significant. So it's, I think it's worth it.
I think it's
our nurses have it.
Mine is $1 million and it's $135 a year with the rider for consultation.
Yeah,
because
about that too.
As school nurses, what is one of the major things you do? You teach and you educate. Okay, next, please. So keep calm. I'm a school nurse because you know what? You are phenomenal. You are absolutely phenomenal with all of the things that you do and everything that you see that you just have to integrate. And that's why nurses are so good at this. Next, please. We will, we have the URLs for everything too. And then this PowerPoint will be put up there as, actually it's up there. It's over on the very far right too. And all of the links are there. So student enrollment requirements. Next, please. Okay, superintendent, Virginia Department of Education annually publishes on the website, student enrollment requirements, excuse me, I haven't had enough coffee this morning, for school year. And here is the link. And if you wouldn't mind clicking on that, please. And we ask you, read it every year because it changes. And this is what the changes are. And if you roll down, it's going to be compulsory attendance, home instruction, that we don't need to worry about, religious exemptions, but it's going to have, keep scrolling down if you wouldn't mind. We're going to have the immunization as well as too, which is in there somewhere.
I think it's next. Yeah, physical, and there's the immunizations.
Yeah. So we have that. So anyway, and that is also up on the Padlet. We can go back to the main part. So now you know where you can find it. So you don't have to go necessarily hunting through the VDOE website. Next, please. So physical examination, Code of Virginia, 22.1-270. No pupil shall be admitted for the first time to any public kindergarten or elementary school in a school division until such pupil shall furnish prior to admission a comprehensive physical examination within 12 months prior to the date such school first enters such public kindergarten or elementary school. And that is the Code of Virginia. This is, remember, this is for public schools only. So that means, Becky, your schools start what, August 1st?
August 5.
August 5. So let's look at it. If this has to be within 12 months prior to the date of entering public kindergarten, if they start August 1st, August 5th, then the earliest date that a kindergartner can have on his or her physical is going to be the 6th of August, 2020.
Yep.
Okay, next, please. Again, that means there is no grace period for obtaining a physical. Students entering Virginia public schools for the first time in a kindergarten or elementary school must have a comprehensive physical before they can enter the building. There is no legal requirement for a physical exam for students entering grades 6 through 12. Some schools have established, the school divisions have established policy requiring a physical for these students. So you need to check with your school division policy for guidance. And Becky and I will remember when that went into effect. All of a sudden, the 6th through 12th graders didn't have to have a physical. I can do anecdotal. I had students coming from a different country, and principal tried to allow them in without a physical, and guess what? They tested positive for TB. So this is why we do it. Next, please. And hello, Tracy. Tracy White, who is our school.
Hey there. Hi. Can I just say welcome to everybody?
Of course you can. Of course
Hi.
you
Hi,
can.
Becky.
Good morning.
Thank you.
Good morning.
I just want to welcome everyone to the new school nurse orientation for today. And I want to thank Becky and Diane for working so diligently. You know, we're feeling now like the teachers did when everything went virtual. We had to figure out how we were going to do those things that we did in person virtually. So we're glad to have 123 of you on the line today for this important orientation. And so I just want to welcome you, and I'll be just touching base here periodically. I'm monitoring the test taking strategy session, so that's an all-day thing. And feel free to, you guys have set up how you want them to answer questions and things like that, but I want to welcome you and let you know that we'll be, actually, I'll probably try to put the link to the listserv if you're not already on a new school nurse listserv or the school listserv. We will be holding, we will be meeting by Zoom every couple of weeks for the first semester. So you can kind of settle into your new school. And those of you that have been in school nursing and have been to the Zoom meetings, it's nothing new for you. It's good review. But we'll continue this orientation process in a 2.0 version and a 3.0 version throughout the year. We chunk it down so you're not quite so overwhelmed. Get you what you need to know right now to get your clinic set up and get moving. And so again, I want to thank Diane and Becky. I know Becky did CPR training yesterday and was super, super busy. And Diane's and I have been working pretty closely together on many things, but among them, this as well. So just saying hi. And I'm getting questions, but I'm going to let you, go ahead and answer Lori's question, and when you decide you're going to answer your question. So, all right.
Yep.
So
Okay.
take
Okay.
care.
Thank you.
All righty.
All
Okay.
right.
All right.
Thanks.
Bye-bye.
Bye.
Leland, if you wouldn't mind clicking on the link, please. Yes, so this is the Virginia Department of Health website, and this is where you can find the physical. If you could click on that right there, Leland, it's come down to the middle. It says Commonwealth of Virginia School Entrance Health Form. There you go. A lot of us, yeah, it is. There is a fillable one as well too. A lot of us just call it the MCH-13. It's for maternal child health, and this is it. It has the physical. And yes, can be accepted from another state. We'll answer that one right away. It does not have to necessarily be on this form. In my experience, a lot of the military ones didn't use this form necessarily, but it does have to have a review of systems. And if you go through all the instructions on that for this, there are specific criteria that it has to meet.
Can I say something about that? Some of you may receive kindergarten physicals because by far and large, that's the biggest chunk of physicals that you get at the start of a school year. And you may get them from physicians' offices where they have their own set of data that they just type in and send you that. It's not on an MCH form at all. You have to really look at it carefully to make sure there's a review of systems on there. We don't like those. They're pretty brief, but we have to accept them. If it has a review of systems and it's signed off by the healthcare provider, which can be a physician or PA or a nurse practitioner, we have to accept all of that. And most of the time, they don't attach immunizations to that. That's a whole separate document. I'd like to hope you don't have those happen to you very often, but there are just some practices that will not a separate form. They just won't.
And part of that is also, in my experience, is that is a detailed form, and they want to do it faster. I will tell you, I ran across one coming in from another state where it was literally just signed by the physician, you know, healthy child or something like that. And I was like, yeah, that not taking that.
No.
And
Yep.
just send him the card. And this is where I would say, we would both say, is take your time to look at the instructions about what is required on that, because just copied and pasted, go to Virginia, send it back to the doctor, and it's like, yeah, we need a little bit more on that. Thank you. So, okay, and then the school entrance physical form and immunization record shall be a standardized form provided by the State Department of Health, which shall be part of the mandatory permanent student record. The physical is part of the permanent student record. It does not necessarily, as Becky said, be the one that is provided by BDH. So, but it is part of the permanent record.
Mhm.
And also, I will tell you, for instance, I know Kaiser frequently does, they will print out their own immunization record and just staple it to the physical form. They won't fill it in on the other one, which, as long as you got that immunization record. Okay, next, please. Exemptions. Code of Virginia 22.1-270, paragraph D. Allows for parents who object to a physical examination on religious grounds to provide a written letter stating that the child is in good health and free from any communicable or contagious disease. This is kind of a well-kept secret. If a parent objects on religious grounds, they need to write a letter that the student is in good health and free from any communicable contagious disease, and that letter needs to be maintained in the student's cumulative health folder. Not something that we encourage.
Mm-mm.
Okay, so next, and Becky is going to go over preschool enrollment requirements because they can be quite tricky.
Okay, preschool. Okay. Preschool is very interesting. The first thing I want to tell you is that preschool education is not required for the state of Virginia. Some school divisions have preschool programs and other school divisions don't. And because of that, there are not a lot of criteria listed anywhere for how you handle preschool physicals and immunizations. I'm going to speak to what we do in our school division. If you're in a school division that has preschool program, they may take a little different approach. But when we have children who are in preschool education, they're there for one of two reasons. They've either been officially enrolled in the school because they have they're in need of specialized instruction. And primarily that is speech, but it also could be children who have developmental delay. They have been identified as a student who needs specialized instruction, and they are in a specialized preschool education program. And then there are the children who are in a preschool education program that provides primarily enrichment support for them before they enter public education. And there is no document. I have looked and looked. There is nothing that specifies the responsibilities of healthcare providers or specifically states the enrollment requirements for preschoolers. If we can move on to the next slide, please. However, if that child is going to be in a preschool program where they're receiving special education or specialized instruction, those students are required to have a physical and age-appropriate immunizations in order to attend school. So when they've been identified, they get a physical. The MCH 213 is the form that is used, and the immunizations are interesting because they're age-appropriate. So if you have a 3-year-old in a preschool program, there are certain immunizations that they're going to need at that age. If a child doesn't start to 4, they may need one more. We really look to see that they have at least one of everything before they start it off. If they're special ed, they absolutely have to. But now if we move to, I don't know if this is the next slide or not. Yeah, I'm gonna back up from that a minute. We can stay on this slide. But if they're not, if they're in preschool program for enrichment, in our division, we made the decision that we would still like to have physicals on all those children before they come into the program, and age appropriate immunization. So we use the same criteria no matter what the criteria is for that child receiving preschool education. And that has worked very well for our school division. Your school division may do something very differently, but one of the reasons we look at it that way is oftentimes these children are in programs that are housed within the school building, and they may be walking out into the school building during the day. We want them to have age appropriate immunizations. We want some protection to be in place for them if they have to go to the cafeteria or the playground or the art room or wherever it may be. But that's our division. So that if you have preschool in your division, take a look at that and see how it works for you. I do want to say, if a physical is required for that child entering preschool, they now, when they transition, and that's this slide, when they transition into kindergarten, that preschool physical that got them into the preschool program does not apply to kindergarten, because kindergarten is public education and it is required across the state, and that is a new physical to enter kindergarten. They're not the same. So your children who started preschool, oftentimes, or not oftentimes, all the time, will have two physicals. And you don't get rid of one. You don't replace one with the other. You keep that preschool physical on file in your cumulative health record, and you add the kindergarten entry physical to it. Both of them remain permanent parts of the permanent cumulative health record.
And I will also say you will frequently, not frequently, but you may get pushback from parents who don't understand that. And Becky explained it in a perfectly right way. Kindergarten is when public education is mandated, and that's what they need. So they do have to have that new physical.
And it can be easy to have a gap in there. Think their children, because they got that preschool physical, they need everything, or I mean, they have everything they need. No, they don't. They back, and then definitely are going to need booster immunizations before they start this school year. So those take careful review from the school nurse before the start of kindergarten. Okay, now back to you, Diana.
Yeah. Okay, so, and this is fast, middle and high school enrollment. There's no requirement for a physical exam, but they do have to have up-to-date immunizations. And we will go through that shortly. Next, please. We do have some unique considerations, and we're just going to very briefly touch on this. Further on down the road, we will get into more depth on this, but that's homeless. And the McKinney-Vento Homeless Education Assistance Improvement Act of 2001 governs the enrollment of homeless students. Every school division has a homeless liaison. Please remember that, because a lot of times when you have questions about when a child is enrolled who is homeless, that liaison can answer most of those questions. So that's definitely an important number for you to be able to write down on your list, which Becky will go through later on, of your phone numbers that you need to have. Students who are homeless and who do not have a physical or immunizations are immediately enrolled. Again, they are immediately enrolled, but every effort is made to get those documents as quickly as possible. When sufficient time has been provided, the student can be excluded after prior notification has been given to the parent or the guardian, if they are not making that effort to get the necessary enrollment requirements. A lot of times the parents will go ahead and just start revaccinating if they can't. That we had several kids that came up from after Katrina, and of course that they had nothing, absolutely nothing. So they were immediately enrolled, but some of the parents chose to just revaccinate, and some of them We just worked on it to see if there was anything that was
Right.
retrievable. The next one is foster children. If Department of Social Services is unable to provide the necessary documentation for enrolling the student, enroll them immediately, and the person enrolling shall provide a written statement that, to the best of his or her knowledge, sets forth the student's age, compliance with the requirements, and that the student is in good health and free from communicable or contagious diseases. Okay. And again, social services, your social worker should be able to help you with that. Military compact. Compacting states give 30 days from the date of enrollment for the students to obtain any immunizations that are required by the receiving state. That does not apply to the physical exam requirement for K through 5. Okay, so most of the time, the military compacts, they will have those 30 days, although an awful lot of the military will carry their immunization records with them as well. And then special education, and Becky's going to go into that. And we will have a very detailed coverage of special education down the road as well too. If a child with a disability is living with a parent in the residence of a local school division, the local school division is responsible for ensuring that that child receives a free, appropriate public education, even if the enrollment requirements for the child are not completed within a reasonable period of the parent's request to enroll that student. So it gets complicated, and we will address that later on too. Okay, next please. Required immunization. So you've reviewed your immunizations. Where do you go from here? Who do you contact? You call the parents and you get nowhere. Is it the principal? Remember, they serve in loco parentis. What questions? Who did your orientation? If you have a supervisor, call them. Do you have a mentor? Call them. Call your local health department. And remember, you can always call VDH, the Virginia Department of Health, because they are the experts on immunizations. Okay, next. Immunization requirements. For specific requirements, access the Virginia Department of Health website. If you wouldn't mind clicking on the first link, please. Here we go. Every year, VDH comes out with this. These are the minimum requirements that are required to enter school. And we do have this on the Padlet as well too. And it gets very specific. If you can go back, please. And then click on the supplemental ones. And I think most of us use this a lot. Don't you, Becky?
Yep.
This is the supplemental guidance, and it also gives you the brand names of the vaccines too. There are a lot of good information on this as well too. And again, this is on the Padlet. You can go back and we'll just briefly go through. The next slide, please.
And I would suggest if
Print it out.
first two documents, print them off.
Yep.
Put them in something, whether that's a sleeve or a notebook, however you want to do it. Pin them to your bulletin board because you're going to refer to them a lot.
Yep.
You get questions throughout the year that you need to be able to respond to quickly. And it's really nice to have that information right at hand to help parents.
You really do. It's very important. But just briefly, we're going to cover these. So first one, diphtheria, tetanus, and pertussis. It's either Tdap or DTP, and we're not at this point going to cover catch-up immunizations. What that child needs, 4 doses. The one has to be on or after that 4th birthday. Okay, next. So then we move into Tdap, which is tetanus, diphtheria, and pertussis. And 1 dose is required for 7th grade. It's not the same as Tdap, the first one, because that has a bigger dose of diphtheria and pertussis. But Tdap has 2 manufacturers, and Boostrix is one, and that's for 10 to 18. And then Adacil is 10 to 64, and that is more commonly available in the pediatric offices. Okay, next, please. Hepatitis B, 3 doses. You have to meet that minimum age and interval, and the requirements must be met. The 3-dose vaccines follow the CDC guidelines. The first dose is usually given in the hospital right after birth, and the parents may opt to wait for that first dose if they're going to see their pediatrician in the first week or 2. The second dose is given at a minimum of 4 weeks after the first dose, and the third dose must be given after the 24th week of age. If it's too early, it's not a valid dose and they need a booster to start school. There's also a 2-dose schedule for adolescents that are 11 to 15-year-olds, which is Recombavax too. Now, in my experience, a lot of times you'll get an immunization record that will say the first dose was given at birth, but there's no date. We have to have that date. So hopefully the parents can track it down from the hospital, but sometimes hospitals will say, we don't know, which is really poor on their part, but you need to have that date. You can't just say that it's going to be, it was given. Yeah, they got it at 12 hours of age. Okay, next. Human papillomavirus, HPV. This is a 2-dose series for all students entering 7th grade. And again, we'll go through this a bit later. This is new. This is for both males and females, and it is very unique. It's allowed after reviewing materials approved by the Board of Health. Parents or guardians may opt out. There is no form that they have to sign. They can just verbally decline that they're not going to get their student immunized against HPV. It is, and still after all these years, is somewhat controversial. There's a lot of really good information that the Virginia Department of Health puts out about it because of the specific types of cancer that it does prevent. It is mandated, so it is available from the health department, and it does prevent 6 types of cancer, including it is about 99% cause of cervical cancer, but it's also a leading cause of oropharyngeal cancer. Next. Measles, mumps, and rubella. 2 doses of measles and 2 doses of mumps, 1 of rubella. The first dose must be administered on or after that first birthday. And the second dose is given prior to starting kindergarten. So a lot of people think that it has to be at 4. It doesn't. Some of the pediatricians really do prefer to wait until right before when they do that kindergarten physical, then they're going to go ahead and get that second dose of MMR. It's usually an MMR, and the first dose has to be 12 months or older. And any change in the immunization administration schedule would require a medical exemption. Kids with really compromised immune systems, if they're on chemo or a biologic, may not be able to receive the vaccine. And that's where you really need to talk to the parents that if you have a case in the school, that child's going to be out during the period of contagion with that. Okay, next. Polio, which is IPV in the United States, we only give the injectable now, and it's 4 doses, 1 on or after that 4th birthday. That 4th dose is not necessary if the 3rd dose was administered at 4 years or older, or at least 6 months following the previous dose. Okay, next. Varicella, chickenpox, 2 doses now. 1 dose on or after that first birthday, and the second dose, again, is prior to entering kindergarten. And that could actually be the MMRV out now where they have all 4 of them in there. So again, first dose at 12 months or older. And again, any change in the immunization administration schedule requires a medical exemption. This is another one. MMR and varicella are live vaccines. So a child who has a very compromised immune system, is on chemo or a biologic, may not be able to receive the vaccine. There was a lot of chickenpox that was increasing And then they added the second dose, and that seems to be keeping it a lot more under control. Next, please. Okay, Haemophilus influenza type B, or otherwise known as the Hib vaccine, is required only for children up to 60 months of age. So that's going to be the IPOP, which is the inclusive placement opportunities for preschool. And it increases inclusion for a preschool that has an IEP, an individual educational program. BPI is the Virginia Preschool Initiative. So you also may be following up immunizations for Head Start too, which, as Becky was saying, those are going to be your enrichment ones too. Their staff usually has ultimate responsibility for getting those immunizations through, but you're probably going to be tracking it. So the primary with Hib, it's a series of 2 to 3 doses. Depends on the manufacturer, and it depends on the current age of the child, not the number of prior doses, but the age of the child when they start preschool, whichever one it is too. So an unvaccinated child between 15 and 60 months only are required to have 1 dose. Most of them, if they've been following the CDC guidelines, have had more than a couple of those, but they just have to have that one. All right, next. Pneumococcal or PCV. Again, this is another one that's required only for children up to 60 months of age in the preschool, and it's 1 to 4 doses dependent on the age at the first dose are required. Okay, next. New 2021 hepatitis A, which is commonly known as HAV. And this is 2 doses of hepatitis A, and the first dose is administered at 12 months or older. Okay, second one is usually 6 months later, 6 to 12 months later. Next. We're getting into the new ones. These 3 are the new ones, new 2021, and this will be in a superintendent's memo. And this is MenACWI. Also heard it called Menacwi, but it's CDC says it's MenACWI, which is the meningococcal conjugate. And 2 doses are required. First dose prior to 7th grade, and the second dose is prior to 12th grade, which is age 16 to 18. Before everybody panics, this is only for the 7th graders this year and the 12th graders. They're not worried about grandfathering people in at this time too. This year's 8th graders, they're just going to have to wait until they're getting that second dose. They will have that, okay? The guidelines are being updated as we speak too. So that second dose, if you have a student who is 15 and is now a senior, they do need to have another one because this is age 16 to 18 years, okay? If the student gets it at age 16, it counts as the one that they need for their senior year. All right, next, please. Rotavirus, this is new 2021 too. This is a very specific, very narrow window. And again, these are the minimum immunization requirements for daycare as well as school too. These are only for children that are less than 8 months of age. It's 2 to 3 doses, depends on the manufacturer. So there are some school divisions that have early Head Start, which is 6 weeks to 3 years of age as well too. So there are going to be a few that are going to be needing this. Next. Conditional enrollment. Any student whose immunizations are incomplete may be conditionally enrolled if that student provides documentary proof at the time of enrollment of having received at least 1 dose of all of the required immunizations, accompanied by a schedule for completion of the required doses within 90 calendar days, not school days. So the immunization record of every student that is admitted conditionally needs to be reviewed periodically to make sure that those required vaccinations have been received. It does not include Tdap as a series, but as a standalone vaccine. And the exception is hepatitis B, which can't be completed within 90 days. And recent legislation now allows for 180-day conditional enrollment to allow for the proper spacing of the vaccine. That's only for hepatitis B. Next.
And this can get, this conditional
Yeah.
enrollment can get sticky at the start of school. So if you have a child coming into kindergarten and they have their beginning series of DPTs, but they needed a booster and they don't have that booster, they additionally enrolled. They have to get that booster within 90 days, but they can actually start school because they have at least one of every immunization. And there are folks that have thought if they don't have everything they need by the time they start kindergarten, they just don't start. That's not true. They can start, but they really have to come into compliance and they have to bring you or be able to give you a date of when that next immunization is due.
Yeah.
So if they're going to the health department, they're probably going to have a card. But if they're going through a private physician's office, they may just have a date. Mark that date, put that on your calendar somewhere as a reminder to you that Jimmy P is due for that immunization on November the 18th. And when November the 19th rolls around, if that parent hasn't brought you something in, that child is now out of school. And not just till they get another appointment. They're out of school now until they get the immunization.
Yes.
So it behooves the parent to be very much aware of the stipulations of that conditional enrollment. And I tell our nurses to not only mark the date the immunization's due, but back it up 2 or 3 days and give that parent a call 2 or 3 days in advance and say, tell them, I have this on my calendar. You still planning to take Jimmy for his immunization on such and such a date? Yes, we're going. Okay, make sure you bring me the paperwork. That way it's just an extra reminder that A, the child get the immunization, but B, that they don't have to lose instructional time. And
Don't forget
this
to
year
eat
that is
something.
so critical with kids coming back in, some for the first time in a year and a half. It's just critical that we
Yep.
them in school for as much instructional time as possible. So that extra reminder phone call might be real helpful to you.
I will also say in my experience, a lot of problems that you run into are the older kids that come, for instance, that have just come into the country, which we had a lot of too, is the middle and the high school ones. They get conditionally enrolled. They've gotten one, but trying to track those parents down to get those next immunizations can be tough. It requires a lot of work on.
Yes,
your
it
part.
does.
All right, religious exemptions. Sometimes the bane of our existence, right? No certificate of immunization shall be required for the admission to school of any student if the student or his or her parents submits an affidavit to the admitting official stating that the administration of immunizing agents conflicts with the student's religious tenets or practices. This is the Code of Virginia. Parents can use this form even if they don't have a religious objection to it, but a philosophical objection to immunizations. Okay. And there's a question that we'll answer too. Next, please. This is the certificate of religious exemption. If you can download it, if you wouldn't know. Thank you. Okay, that's all it is. It does have to be signed by a notary. It's one thing we can do. But parents who have an objection to their child receiving immunizations, you do have to have that on file as well too. And I will also say you need to stress for those parents too, if that disease, if communicable disease comes into the school, then that child is excluded during the period of communicability. I could tell you when we had measles outbreaks, when you tell them that their child is out for 21 days, some of these parents might have changed their minds. All right.
Also, note that the religious exemption form, once it is signed and notarized, and placed in the cumulative health record, it becomes a permanent part of the health record, and it is lifted when the parent lifts it.
Yes.
It remains in effect until the parent says differently. And we have parents who you will see their children, especially 7th grade and maybe a little bit now 12th grade with these new immunizations. They have all their children's immunizations, but they can't get that Tdap before school starts, or they forgot about it and they want their child to start school. They'll come get a religious exemption form, get it signed just for the Tdap, and then they'll go get the Tdap later on and lift the exemption. They're doing the same thing now. I have seen it, at least in our division, a little bit, where they cannot get appointments for the meningococcal and at 7th grade or at 12th grade, and they're going to do a religious exemption for it. And we have to honor that. That child can be
Yeah.
in school as long as that's on file in the cumulative health record.
Yeah, if you've got the religious exemption form, as well too. And there have been parents that I've run across too that have exempted their child from specific vaccines,
Right.
but they have everything else too.
Yep.
And some of
Yep.
them sign it, they just want to wait until the child's older. They're a little bit concerned with some of them.
Yes.
All right, next, please. Okay, exemptions, medical exemption. No certificate of immunization shall be required for the admission to school of any student if the school has written certification from a licensed physician or local health department that one or more of the required immunizations may be detrimental to the student's health, indicating the specific nature and probable duration of the medical condition or circumstances that contraindicates immunization. So there is an area on the immunization part of the MCH 213 in the middle that has the health care providers can document on there for the medical exemption. That's part 2, section 2, page 3 of the physical form. In my history of my 20 years, we didn't see all that many medical exemptions because most of the healthcare providers, so you're putting your license on the line with that too, that there has to be a documentation of a real reason why that child can't get it. Some of them that we went over before too, if the child's in active chemotherapy, they may put an end date when they expect it to be done. Or if the child has just is undergoing specific treatments, they'll put a specific date on there. However, there are some students who have really, really compromised immune systems or who have had massive seizure activity after specific immunizations where they will exempt them from specifically medically exempt them from that particular vaccine or all of them. Becky got tips.
Nope. You got it perfectly.
Yep. Okay. Next. And we're back to Becky.
Okay, we're going to talk now about the Virginia Immunization Information System, fondly referred to by many of us as VIS. Now, VIS is a statewide immunization database. School districts can participate in this program free of charge, and it was established probably about now close to 15 years ago, somewhere in that range. It is a lovely, wonderful program in that if you have access to it, you can look up immunization records for students or adults instead of calling the doctor's office. Now, not all doctor's offices will participate in this, but I think I am correct on this, that if they accept Medicaid, they are required to enter their data into VIS. What they don't always do is enter old immunizations. If they don't have the staff, the office staff that is dedicated specifically to this data entry program, they may leave out, they may just not enter immunizations further back than say 2000 or 2005, something like that. But if they have entered them, the document that you will see notes all the students' immunizations that have been given. It notes the date they were given. It tells you they're number 1, number 2, number 3 of a series. They'll tell you if the series has been completed. They'll tell you if a vaccination was given that is not valid, either it was given at a wrong time or too soon, so, something along those lines. And so you'll see the entire student's vaccination that was entered into that system. And then below it, there's another whole section that tells you what areas are complete and what areas students still need to get immunized on in order to complete that series. Then the beauty of that is that you can tab over to another area where it allows you to print what we call an official report. And when you print off that official report, it has the seal of Virginia embedded in it. And when it prints off, there's usually a block at the very end of it that designates the school official, which is you. From your division, you sign off. You sign your name, your credentials, and the date that you pulled it off, printed it off of the computer. And now that becomes the official immunization record. This is, I don't know if we can see one in here. Could you click on that for me, Leland, and let's see what opens up?
I think that's just where you have to sign in, Becky. That's just the information.
It's just the basic information.
Mhm.
And if you want to Google it, you can type Virginia Immunization Information System, and you can find out a little bit about it. And we can go back now to our regular slides. What you can't do is you can't just join this on your own. Every school district who is participating has an administrator, and the administrator is usually the nurse coordinator or the nurse supervisor for your division. And that person is the person who registers you to be able to access this information. It's a live program. It's an interactive program. You may not enter information into it. School nurses cannot enter information, but we can review information, and we can certainly print off information. Because it's interactive, it's password controlled, and that password changes every 30 days. And that's what nurses have the most difficulty with. They forget their password. If the system will throw them out after 30 days, but they have developed a way now where a nurse can create herself a new password and get right back into the system. So we've been using this in our school division for a number of years now, probably at least 10 years. And it's a wonderful way to access immunization records for a student. Maybe somebody's transferred to your school and what's in their cumulative health record is spotty, and yet they're coming from another school in the state of Virginia. You can go right to VIS, type in, it requires their name and their birth date. You can find them and print off whatever is in there, and that just saves you some time. Also, oftentimes you may get immunization records where children had immunizations at different places. They had some at this doctor's office, and they had some at this doctor's office, and then they had some at the health department. If all of that data has been what we call dumped into this, now when you access that child's name and birth date and pull up that record, it's all in one place on one document that you can print out and sign off, and now it's an official record. And that's quite nice too, quite helpful. Now, the drawback to this is this only contains immunizations that either, like I said, doctor's offices put them in. So let's say a child transferred to Virginia from the state of North Carolina, and they brought with them their immunization records from North Carolina. They go to that doctor, and that doctor enters those North Carolina immunizations into VIS, as well as anything new they're going to get. Now you can see all that information because the doctor has entered it all. It's all part of the program. But let's say that this child came to this school division from North Carolina and didn't bring any immunizations with them, and the doctor's office doesn't really have anything. All they're going to enter in is what they've received. So this is not always complete. It is totally dependent on what immunization records the doctor's office or the health department receives to actually enter into the system. Can we look at other states? No, we can't. So I can't go to North Carolina and see what this child got in that state, nor can they reciprocate that way with Virginia. However, more and more states have a database very similar to this. They just don't talk to each other yet. I hope that comes someday, but it's not there quite. So if you are interested in this, check with your school nurse coordinator, your school nurse supervisor, or if the person that's in charge of nurses is your student supervisor, check with them and see if your district is involved in this and how you can be signed up for it, because it will save you a lot of time and it has really good, accurate information to keep in the student's cumulative health record. We make copies of those oftentimes when students graduate high school. We consolidate and make copies of those, and that's what they take with them when they go to wherever they're going to high school, if they're going on to higher education or the military or a particular training that requires immunization records. It's all in one document, if that is a complete document. It's very helpful.
I know we had a question as to that if the doctor's offices don't enter immunizations. And as you said before, they have expanded the criteria and the instructions with that. If the physicians are taking Medicaid, if they want to file for federal money, then they have to start entering the immunizations.
Right.
So,
But not all physicians take Medicaid. So
yeah.
There are, this isn't complete by any means, but it is certainly a step ahead of what we used to have, which was we could only rely on parents and physicians' offices, and it was time consuming and it just took a lot of work. It was labor intensive sometimes to get the records that we needed for that child to be in school.
And while we're still talking about it, somebody said that what are consent privacy laws about accessing student records on this. Leland, could you bring that website back up, please? Normally, we were not going to stop with that, but because this is so specific. All right, if you could hit that middle tab right there, this and FERPA. There you go. Okay. The parent or guardian must grant permission before sharing or including the immunization record in this. So they've given their consent to have it put into this. All right, and they know that
the health department or the physician's office.
Yes, and they know that it will be shared, that other people can access it. Okay,
Right.
So they've given the permission on that. Thank you, Landon.
It's a good question.
Yeah. All right, next please. It's going to be Becky soon. So then we're going to just look at briefly the Virginia High School League physical, because those of you that are going into high schools right now too, you're going to be getting a lot of these especially. So VHSL updates it usually in there. If you click on that link right there, please. Here it is. And in my experience, most of the time, this is exactly what they're going to use is the positions like this one too. It's also been used a lot with camps as well too. Okay, if you want to, this has all of the information that they need on it. Okay, if we can go back to the slide. Thank you. Many schools do sports physical clinics. They'll run them sometimes they'll bring people in from some of the local hospitals and such like that. Some of the parents who are healthcare providers, physicians, nurse practitioners, PAs will volunteer their time. Sometimes the school nurse, you may be asked to do pre-exam data, do the height, weight, vision, hearing screening, such like that. I was doing blood pressures one time too.
Yeah.
So, okay. But I suspect that you may be getting, and frequently those clinics will run either in the spring or they'll, because it's good for a year, or because of COVID, they may start doing it this fall or something like that to cover for the spring sports. All right, next. So keep calm and don't give up. I know we're throwing things at you too. And take a deep breath, because now we're getting into some of the other stuff. So Becky, you want to take it?
Sure. Okay, if you could click onto this Padlet and there we go.
That's going back to
Right,
Tracy's.
Diane, go ahead.
Oh, this is basically what we're saying is that that's the professional development. That's where pretty much everything is going to live. And you can scroll down at the bottom to see where everything else is. We have a whole bunch of stuff in there. And what's not there is we're trying to build into, so trainings, you have some of that additional. There are a lot of immunization webinars. And the other stuff we're trying to build into the new school nurse orientation Padlet too. So what we want you to be able to do is know where you can find this stuff. Not necessarily that you may have it at your fingertips all the time, but you know where to go. Okay, if we can go back to the slide, please.
Okay.
All right.
Okay, Diane, that's you.
Okay, did we get the, I think I'm out of line. Okay, new school nurse orientation. You should get a nursing orientation from your supervisor, hopefully. If your supervisor is not a nurse, seek the advice from a nurse from another neighboring county. You can contact the school nurse consultants, which would be Tracy White or me while I'm here, or Joanna Pitts with questions. And we do have some sample orientation packets, not necessarily in the notebook, but there is one. We have a checklist on the Padlet as well too. Obviously, we couldn't do notebooks this year. Okay. Next, please. All right, just basically setting up your clinic. We suggest, view the NASN website for suggestions for questions and answers. If you can go ahead and click on that first link, please. This is NASN, and you can print this out or just keep it as a favorite. It just kind of gives you checklists about what you might be encountering. Now, granted, this is 2021 school year, but it's going to be a lot, because you may still have some kids learning virtually. And with a lot of these checklists, it's just you take what you need and ignore the rest.
Right.
We're not saying, and this is where some people get hung up on it, well, this doesn't fit my model, or this doesn't fit what my school wants. Take what you can, and they're just suggestions. If we can go back to the slide, please. And click on the other link, please. Highlight that will pop up. Okay, this is kind of cool. Leland, if you wouldn't mind hovering over some of the, like the vision and hearing chart with a cursor, yeah. So it'll tell you just some suggestions. This is actually kind of fun. This is the NASN toolkit. If you can move that, see, here's your framework from the NASN school nursing. Every student counts, the school nurse day, calendar. There are a bunch of your toolkits that NASN has. So it's actually kind of fun. And the NASN website does have podcasts and learning, e-learning, whole bunch of journals, drugs. I mean, it's a lot of information. Oral health, which of course is huge. Yes.
Did you talk about NASN?
No, we do it at the very end.
And,
Um,
but
what we can do here, yeah.
we'll say it briefly. NASN is the National Association of School Nurses, and VASN is the Virginia chapter of NASN. And there's a membership charge, but if you join NASN, the one thing I will tell you, if you decide to join it, is it has, I mean, a wealth of
Yep.
school nurse trainings that have attached contact hours to them. And they're all very specific to school nursing. So it is a great place to get those contact hours that you need for every 2 years when you have to have your hours of professional development in place. This is just one more place that you can get them. There, you also see on the Padlet, the professional development Padlet, there are webinars on there, and some of those webinars have contact hours attached to them. And I know I'm breathing off a little bit, but I wanted to say it while we were there, that's NASN has lots of parts to it. It has position papers to it. It has blogs to it. It has information. It just has a lot of different things. But one of the really nice things is all of its professional development that is free to members. So I just wanted to pass that on. When we throw out NASN, that's what it is. You're not compelled to join it. It is totally voluntary. It is just an association that's very specific to school nursing. In fact,
yes, and thank you. It's very supportive too. And as you can see where Leland was scrolling down there, just all of this information right here. And a lot of this we've loaded onto the Padlet with the activities calendar template, back to school, school checklist for school nurses. Yes, you do have to be you do have to be an RN to join.
you have to be an RN.
Now,
Yes.
the one thing is also, if you join NASN, you automatically get your VASN, Virginia Association of School Nurses membership as well too. Okay,
Okay.
thank you. All right, next one, please.
Okay.
Yeah.
You need to know to start school. So I know some of you have already been in your school for 1 or maybe 2 years. And so some of this you're going to know. Some of you may have just gotten this job this summer and you have been told you need to attend this new nurse training and you don't know a thing about what your school is going to be like. And you're just entering into the school system for the first time from perhaps a hospital setting, which is entirely, totally different. I will tell you, as I tell all of our nurses, you are like a green fish in a sea of purple fishes. You are, everybody else is in education. They all talk educational lingo, and then there's you. And you are there for a very important reason, but you're on their turf. And you have to figure out a way to integrate yourself into educational territory. You have to learn that lingo. You have to learn how schools function, because your work is to support that student being successful in the school day. And your part is the health piece of it, supporting the health of that student so that they can be successful and make academic progress during the school day. Even if it's a little tiny bit, the work that you do may be that one little bit that's keeping them from making progress. So your job is very important, but you are going to be by yourself a lot. So that means you depend on the nurses that work in schools close to you, or within your district, or within your section of your district. You learn to depend on each other. Some school districts have perhaps physicians attached to them. Some school districts have nurse practitioners attached to them. Some school districts have none of that. And those nurses fly on a wing and a prayer. And that's me, that's us. We don't have any medical attachment We don't have anybody to give us orders. And I think probably that is the most difficult part of transitioning into school nursing, is that you come from somewhere where you are immersed in all medical, and there's somebody above you that can give you orders and guidance. And here you kind of have to go seek that out on your own, or have none, and you need to make decisions on the fly. So that's my little speech about what it's like entering into the field of education as a school nurse. But if you are called to help children, if that is your calling, and you want to do this, and you love the other perks of education, this will be a great fit for you. So when you start in, depending on when your school starts, probably the first thing you need to find out about, of course, is where your clinic is. And those of you who have been working for a year or more, you know that. But if you're brand new, find out where your clinic is. And once you get in there and kind of get settled and see what it is. And so let me stop and talk about what a clinic can look like. It can be some little hidey hole. I'm not kidding. It can be a nice, substantial little office that holds a couple cots and filing cabinets and has a sink and a bathroom. It can be a classroom that's not needed anymore. So it's a great big room, but I circle back around. It can also be a little closet and the bathroom's down the hall. I mean, there's just all kinds of situations with what a clinic setting looks like. So once you get there, you need to make friends right away with the office staff. Your secretaries are going to become vital to you. And I say secretaries because it could be the office secretary and it could be the bookkeeper. Oftentimes there's a bookkeeper in the office or the office complex. Both of those people are going to be helpful to you. That secretary knows everything. She or he knows everything about the school. They can answer your questions. That's one. Two, your administration. You absolutely need to know who your principal is and your assistant principals. There might be more than one. Some school divisions, the nurses are hired separately. They're hired in another part. They're hired at a central office, and then they're assigned to a school. So they've never even met the principal until they walk into the door. Other schools, the principal's part of the interviewing team, and they've met that principal at the school while they were being interviewed for the job. So whichever way yours is, make sure that you have at least met all the administration and introduce yourself. Then you kind of want to take a tour of the school. The school will have a map. Every school is required to have a map with all the entrances and exits and all of that for drills, which we'll talk about later. But walk yourself around that school. Go in and out of places, see what's what, because you're going to be out in that building from time to time, and maybe a lot of the time, and you need to kind of become familiar with, where different grade levels are, the cafeteria, the library, what the bathroom situations are like, what the playgrounds look like, what the equipment looks like on the playgrounds because of accidents, etc. Just familiarize yourself, and also especially the exit points of the school. In case there is an emergency, how do you get out? And back in again. Your administrator probably is going to be the person that will talk with you mostly about how you enter and exit your own school building. My schools in my division now they're locked. There's one door open, and it doesn't necessarily open into school. It's locked. You have to be buzzed into it. It's only unlocked in the morning when kids are unloading out off the buses. Other than that, it's locked. Every door in the school is locked. You'll have to have access. So this is really basic. Your administrator or your office staff, your secretary, will give you whatever it is that is an entry, whether that is a key, or for many of us, it's an activated badge that gets us into the school, gets us into different areas of the school. The next question on that area, on that issue is, how do you access the rest of the school building? Should a school nurse have a master key? where she could get into any classroom if she needed to? What if there's an accident or an incident in there and the door is locked, but she needs to get in there for some reason? What if a kid left their diabetic bag in the classroom, forgot to take it home with them, and the parent needs it, the nurse is there? Many nurses will have a master key to their building, but again, that is worked out between your administrator, your office staff, and you. So that's all I want to say about that now, is familiarize yourself. We're going to talk about this later, but I will tell you, by law, probably 7 years ago now, Virginia requires stock epinephrine to be on site in every school building. And it may not be locked up. It has to be easily accessed, and it is stock for if there is ever a need for it, there has to be access for it. So you'll need to look and see where that is. Also, I won't tell you that every school has AEDs, but most schools have them now, but not all districts can afford that. But those schools that do have them, they have AEDs in their buildings, and usually they have at least 2. Some, depending on the size of the building, they may have 3 or 4, but they usually have one near the office. They usually have one near either the cafeteria, the gym, or both. When you take that little tour of the school, keep your eyes out for things like that. You know, where the fire extinguishers, where the AEDs, they're almost always mounted up on the wall in a common area so that anybody could access them if needed. Okay, if we can slip to the next slide, please. Now, next step is going to be, how do you get a hold of folks? Now, depending on what your school has, some schools, you have a handbook. There's a handbook that you'll have for your school, and in it, they'll have every single staff person in that building, and they'll have how you contact them, whether it's an in-house phone system, whether it's a classroom that you dial a particular number for that classroom, they'll have that set up for you, because everybody needs that. In our division, we have phones in every classroom, and nurses can contact anybody just by dialing, a 4-digit extension, but it may not be that way in your school. So you need to know how to contact teachers. Well, it really will be anybody. If there's that list, and I've never seen any place that did not. Have you, Diane, that did not have a list? They all have a list of everybody, what they do, like what grade level they're at, or are they related arts, or are they special ed, or are they a parapro? They have what their job is and how you can reach them.
It may not necessarily include the school nurse on the list, but
well, that's true. They don't put us on there. So that's then something that you send out.
Yeah.
And how does your administration want to be contacted? And that's a good question to ask them. You know, how do you want me to get a hold of you? Do you want me to go through the secretary? Do you want me to go down the hall and see you at your office? You know, how do you want me to handle this? Your administrator, the buck stops with your administrator. Yeah. That administrator is in charge of everything. So when you really need good, firm answers on how something's to be handled in school, go to your administrator, because they have the final say. Okay, and if we slip to the next slide. Okay, now we're going to take a look at what's in your clinic. And you already heard me talk about what clinics can look like, but look through everything. If you're brand new, look through every cabinet, shelf. If there's things that are locked up, get the keys from somebody, whoever has them. Maybe they're in a desk drawer, maybe the secretary has them. Unlock everything, look through, and if you can see that you're in short supply of items that you know you might need, you can start to make a little list. I will say that different school systems have different ways of how they furnish supplies for the clinic. Some schools have a line item in their school budget, and they purchase what we call consumables. So that's all your first aid supplies. If you need thermometer sleeves, if you've need alcohol, whatever it is that you need for your clinic, that's consumable, the school building supplies it. Other schools, all of that is run through a budget at the central office for the school nurses. You need to find out what that route is like in your school, so that when you run short on supplies, who do you go to say, I need to have some things replenished?
And I would also jump in that some schools have what they call the passive supplies too. For instance, every 3 months, you'll get a whole bunch of 2x2s or 4x4s or
Right.
sanitary pads too. And keep track of that, because I walked into one school and we had more sanitary pads that were probably 15 years old, because nobody had stopped and said, we really don't need that many at this point. So, get it changed from every 3 months to every 6 months.
Yeah, we do that in our schools now. I have the nurses do an inventory every year of everything that they've got. Everything, whether they've used, including equipment. And that's how we decide what we need to purchase for the next year. And sometimes I'll have one nurse that has just a tremendous supply of a particular item that she isn't using. Somebody else needs it. Well, we just swap out. And in smaller divisions, you can do that probably a little more readily than you can in larger divisions. But do take a look at your supplies. And what kind of supplies you're going to need. And some of that's, your clinic is probably going to be outfitted. You just may find some areas of particular supply that you would like to have that works well for you, that you're doing a lot of, that you only had a little tiny bit of to start with. Start building that list. And that will take months to build. Now, a notebook. Keep one with hard copies of things that you need most. So I'm going to show, I'm in my office right now, you all, and I cleaned up in here so that it would look nice today, because I usually have stuff strewn everywhere. But I'm going to show you this. It's a simple little notebook, but in here I have all kinds of lists of numbers, just phone numbers that I need for folks at the central office, folks, other buildings with teachers in them that I may need to talk to, or a program that I need to talk to. And then I also keep this. And I want to show you, this is black notebook. See how fat and thick that is? That is, remember when I talked to you all earlier about keeping immunization, the minimum requirements with immunizations and the immunization schedule? Those documents that you get, I keep them in a notebook, really handy. It's right on my desk, so that when somebody calls me with a question, I can answer it quickly. For me, it's going to probably be nurses calling. For you, it's probably going to be parents calling. So it's a good thing to have a notebook where you just keep really important information you need to lay your hands on quickly. Phone numbers, who to contact when you need help. When I say backup immunization and contacting parents, I think just finding out, like if you have an emergency hit the clinic, who else do you pull in to help you? Every school system is to have first responders who are trained, and we'll talk about training in a little bit. But everybody is to have first responders who are trained in CPR and first aid, and they are the persons that would come on the run if you needed help. Who to contact when you need help with immunizations. Diane referenced this earlier. You can talk with other nurses that you work with closely in your school division. You can talk with your local health department. They are just a godsend. The public health nurses are great. They know immunizations, and they can give you really detailed information on what needs to happen next. And then you can always, of course, there's VDH and the Department of Immunization within there if you've got a more general question. But usually you can go locally and find the information you need. Now, contacting parents, every school system will have some method set up, some program set up that contains emergency information on a student and how parents can be contacted in an emergency or illness or an injury or there's a behavior issue or a discipline issue or an attendance issue. Who do you call? Most of that, you all have seen this because if you've had children in school, if you have children and you have them in school, you know what you complete every year. Some of it's done online, some of it's done hard copy, but it's always the demographics of name, address, phone numbers, and then the listing of emergency contacts and those phone numbers. My very favorites are the people who have no emergency contacts. They only have one parent and the number doesn't work half the time. And then my second favorite is they'll list a person's name as emergency contact and nothing else, first name and no phone number. And that's what nurses deal with a lot. And that's where you work with your secretaries, because maybe they've gotten some new information in. Maybe the student can tell you, if it's a real emergency, the student can tell you somebody that, you know, my mama works at such and such a place now, and you can contact that place. So there's a whole conversation about how you contact parents, but these are all things that you need to figure out what your school already has in place for this. So do not recreate the wheel. Do not reinvent anything. If what is there has been working and you just need to learn how to work within it, fine, start with that. And then if you need to make changes over the next year or so, make them. But you're probably going to be better off if you walk into what's there currently in place and use it as long as it gives you the information that you need. Now, if you walk into a system where there is nothing set up, then you're going to have to establish it on your own.
And I would also say, check with teachers frequently too, if you have no emergency contacts, because a lot of times the teachers will have numbers and they forget to tell the office, and they certainly forget to tell you too. Sometimes that the parents will give them other ways to contact them.
That's a great point. We were talking about this yesterday, and I said, do we have people still in our division who do not have computer systems in their home? We do, very few, but I said, do we have people who do not have phones, cell phones? Very, very few. Even if really is without income, they are pretty poor. They'll have a phone because that's their connection to the world. They will have a cell phone. So that's a change from what used to be. It used to be when landlines, if you didn't pay your phone bill and you didn't have a landline, there was no other way to contact you. But that's kind of antiquated now.
Yes, and most of even the poorest of the poor will have a cell phone. Generally, they may not give you the number, which is why I said a lot of times the teachers might have it because they don't want the school staff to have it. But if it's an emergency,
they want it. The other thing they will do is know always nurses are in a very unique position in school. They are considered a neutral zone. Kids consider school nurses a neutral zone, meaning we are not associated with discipline, attendance, or grades. We are a neutral zone. And so kids will come and talk to you a lot, and they'll unload stuff that they may not say to anybody else, particularly to somebody that's going to either have discipline issues or grades. That they're not going to say anything, but they will to you. And the same goes for parents. The parents will unload to you and vent to you about concerns they have because they consider nurses safe and trusted. And so oftentimes a parent will give you a phone number and they'll say, I don't want anybody else knowing this, but if you run into an emergency, here's how you can get a hold of me. So I definitely have seen that happen.
Yeah.
Okay. And we can slip on to the next one. Okay, now we're going to move on into trainings. And who, what, when, where, how, and why are the questions that we're going to address in these trainings. And we'll move on to the next slide. We have certain trainings that are mandatory trainings, meaning they are mandated by Virginia law. and I want to speak briefly to these. The first is anaphylaxis. So when the law was passed for stock epinephrine to be placed in every school, we have to have training for folks to use that stock epinephrine. So all this law says is that there have to be designated personnel trained every year. These are annual trainings. Some school divisions do that. They just designate certain personnel to do that, take that training and know how to use an EpiPen. Other school divisions make a decision to have it mandatory for all their staff. That is the way it is in our school division. All of our employees, from the bus driver to the food services worker, to the custodian, to the teacher, everybody goes through anaphylaxis training at the beginning of the year and manipulates and sees how to use an EpiPen. So the training has to be there. You may do it homemade. Some school divisions develop their own training. They produce a PowerPoint series of slides that they use with their staff. Other school divisions may incorporate one that's already produced, and folks just watch that on their own, and then they come together for some kind of what I call hands-on. Some divisions just have the mandatory training online, and you watch it and you don't go see anybody else or anything. You sign off on it and it's completed. So every division is different. You need to see what your division is doing. If you are an RN, you will be responsible for this training for the staff in your school, whoever's designated in your school. If you are an LPN, LPNs cannot do mandatory trainings. They can do them along with an RN, but the RN needs to be the person who is signed off for mandatory training. Then we have OSHA and bloodborne pathogen exposure. And I could repeat myself. Some school systems will use I call it a canned product, and I don't mean that badly, because there's some really good trainings out there. They use an established training that people access online, and they sign off that they've received that training. And then when the school nurse meets with them, we always want them to know where the exposure packet is kept in the school, because as I tell ours, if an OSHA representative came into your school for whatever reason, which I've never had happen, but if, and they would ask you,
She's laughing at that.
Kept, you have to be able to tell them where it's in the office, it's in the clinic, wherever. So we make sure that all of our staff know, our bus drivers know, our food services folks know, everybody knows where exposure packets are kept, so that they know what that means is they know where to go to if they have bloodborne exposure, if they're a part of an incident. So those are two trainings that are required by law. Remember when I talked about you need first responders in your building, that you have to have at least two, and they cannot be, the nurse cannot be considered one of those first responders. This is two people in addition to the nurse, have to be trained every year. They have to agree to it and be trained in CPR and first aid. They may receive other trainings as well, but they have to have CPR and first aid. And different school divisions handle that different ways. In our school division, all of our nurses are CPR instructors, and we do all that training. In other school divisions, that's contracted out to a separate agency or a separate company. And then there's some divisions that do all that academic training online, and they just do the skills checks with a trained instructor, perhaps from fire and rescue, some type of emergency services. So it can happen lots of different ways. The bottom line is you have to have at least two folks who are trained, and you may have folks in your building who are already emergency responders, like they may work for EMS, they may be a firefighter, they may already be trained and certified in CPR and first aid extensively. They can serve as your first responder for your building if that's what you want. And it's not what you want, it's what you and the principal talk about, and the principal designates. The principal designates who these people are that are considered to be the first responders. But don't forget about those folks that already have that training certification in place. They may be very willing to do that. You can certainly have more than 2 first responders. Big schools certainly do. A lot of them like to have 1 on each wing if possible. But it depends on interest, and it depends also financially, because there's a cost to all this training. Some of it's free, but some of it has a cost associated with it.
I could also say too, with the majority of CPR is 2 years, but these have to be updated annually. And a lot of times teachers, well, I was trained a couple of years ago. Well, no, we still need to do that. And if we could ask everybody to mute themselves, just to remember that at this point. All right, sorry,
That's okay.
go on. Oh, not, no, Becky, you're muted.
There we
There
go.
you go.
If I don't know how that happened. Okay,
Yeah.
if you can click on the emergency care plan, please, and thank you. Okay, we can't access that.
Huh?
We can't access it.
Oh, that's interesting, because I had it, I linked it last night. All right.
I'm sorry, it won't open.
Yeah,
It's-
that's
it's
interesting. 'cause
okay.
I checked it last night.
We'll
Okay.
try to fix that later on.
Mhm.
See where the stock epinephrine is located? You're going to hear me say over and over again, in our schools, this is what I do, because I'm just giving you a suggestion.
Yeah.
Your school may be very different. In our schools, because we keep them in the clinic, if people have to come on the run to grab that bag, and I use a little, like a little pencil bag, and I have the standing orders from the physician, and I have 2 EpiPens in there, a junior and a senior is what I call them, an adult and a child, EpiPen, and they're labeled, that bag is labeled. I have every employee that is in my building, or was in my building, come to the clinic and show me right where it's hanging, because if they had to come on the run for it, they're already in a panic. If they've never seen it before and don't know where to look, they can waste precious time. And there may be something else in that clinic that is, if I say, go run, get the red bag on the wall, well, there could be a red bag on the wall that holds something completely different, maybe a blood pressure cuff, and that would not be the right thing to take. So I make them all come as part of their training and lay their eyes on that as stock epinephrine, so that in case they ever had to use it or run grab it, they at least don't waste time trying to locate it. Now, if stock epinephrine is used, refilling those, I can't say more, Diane, except what we do in our division, which is I would go to our supervisor, and we try to keep a little tiny bit extra, but I'm going to tell you, it is a tight fit epinephrine, because oftentimes it's back ordered, it's not available, and we don't get extra. We don't have extra hanging around.
Yeah, no, in Fairfax, it was the school that reordered it. And I will say we are due for our break in another minute or so.
Okay, do you want to finish? Do you want me to finish this last thing with?
Yes. Yeah.
Okay,
Let's see if we
now,
can get the
we
asthma
both
action
need to
plan.
speak to this together, because this is brand new, that there is going to be required training this year on asthma for, not the nurse, for staff. And Diane, I want you to speak to that, because Diane is working on that training.
Well, that'll be the albuterol, stock albuterol, and that does not go into effect until next January. So,
Is it-
and we, We are working on the training that will be provided for the stock albuterol, and everybody will be nurses as well as the people that are the backups in the school system. So that's coming down the line. But this is basically the Virginia Asthma Action Plan that
Right.
hopefully you have for your students with asthma. The stock albuterol is going to be for students that don't have
it.
They don't either have an asthma action plan or they don't have an inhaler or things like that. Okay.
And we include this asthma training in our medication training. That's
Yes.
going to speak to it then.
Yes.
So
So
I
if
think we're
just so
ready
they
to,
can, yeah,
ready to take a break now, and then in
15 minutes.
we're going to do questions now.
At 11:15, when everybody comes back, then we can
Okay.
take a few of the questions if there are
Sure.
more. I think we've addressed some of them, but if you have questions, please put them in the chat. And this is your time to go get a drink, eat, etc. And thank you guys for listening, and take a stretch break for a bit. Okay, Becky, you ready?
Sure. So we'll move on to our next slide. Is everybody back in okay? Anybody?
We're gonna do questions, that's right.
It's right.
Yeah. Is everybody on? Oh, we have a few more.
Yes.
Okay. All right, so let's see. Again, medications given on a field trip when the nurse is not there. We'll address that a little bit more later. But remember, that is a principal's designee. You
Yeah.
are not responsible for monitoring them at that point. You are responsible under the Nurse Practice Act for doing training. But once they have been trained, it is the principal's designee. And the URL for the new school nurse orientation Padlet we'll do again as well. And copy of the physical exam done within a year of them starting kindergarten, even if it's another district, is okay. Yes.
Yeah.
Same thing about if it's a first to a fifth grader. We get a lot of people coming in from other states, and as long as they've got it. Does the exemption letter have to be signed by a healthcare provider and updated every year? Medical exemption, if it has a date on it, no. Some of the ones, the medical exemption will say permanent, and then you don't have to do that. If there's a religious exemption, no, that is kept in the student's cumulative health folder, and it's good until the parent changes their mind or pulls it.
Mhm.
Okay. Many instances during COVID where a parent can't get an appointment date for a vaccination completion because the provider isn't setting appointments out that far, such as Hep B. Yes, I've been hearing that as well too. And I know there have been parts of the country where they're actually doing like drive-through vaccination clinics to try and keep that up to date. It's my understanding that a lot of the local health departments are trying to set up clinics specifically for back to school to get these immunizations updated. You know, one can only hope that a lot of parents took advantage of the state opening up more to try and get those back to school immunizations done. But we know that parents don't tend to think along those lines until right before school starts.
Yeah.
Yes, military families who receive their immunizations at a military facility will not be in VIS. Yeah, we know that too.
Correct.
And again, if school nurses can't enter immunizations into VIS,
No.
and I would also just say from my standpoint too, is that would be opening a can of worms that would be nice in some ways, because you'd get a complete documentation, but wow, can you imagine the amount of work
Oh,
that would add to?
yeah. Most practices, most big practices, they have one person dedicated just
Yeah,
to data entry. That's all they do, because it's there's a lot involved. There are a lot of screens involved in it, a lot of information to enter.
Yeah. So verify if a 12th grader has had a meningitis vaccine prior to 16 and 18, they can begin school. But if they have not had any, they cannot. You know, the 12th grader has to have had that meningitis vaccine at 16, between 16 and 18. If they had it at age 15, they have to have that second one.
Right.
If they had it when they were 16 and they're now 17, it's fine. But they had to have had it after that 16th birthday.
Right.
And yes, as we said, you do have to be an RN to join NASN. And that's not something that we can control. And we certainly value our LPNs.
Oh, my goodness, yes.
Yeah,
I have two that are
Yeah.
top drawer.
top notch. Yeah.
They're great nurses.
Yes. Yes, I have worked with many throughout my, so many years of nursing.
Yeah.
Becky and I didn't know each other at UVA, but I know a lot of her classmates. So,
Yes.
um,
I will say, looking back, you saw how many of the immunizations had birth dates attached to them.
Yeah.
And when you get physicals in, it's really important that you look at those immunizations carefully to make sure that they were given after a certain required date, a fourth birthday, or within, the start of or 12 months apart, whatever the immunization stipulations are. You've got to check and make sure that that's the timeline in which they were given. And you will get kids who they were given out of timeline. And that means you have to circle back around with that parent and say, I'm sorry, this was given too early and you need to go back and get this done again. And that's a hard conversation to have, but it is the correct and best practice conversation to have.
And I will also say, during a lot of my experience, if you're getting students in from other countries, because they will often, Asia will give a measles vaccine at 9 months. And then the parents to be told that, no, that doesn't count in the United States. They have to abide by what the CDC guidelines are. And then there have also been cases where, most of the immunizations have that 4-day grace period now. Well, that student was given something 6 days before that birthday. And by the guidelines, that doesn't count. And that can be a really difficult thing to have to deal with, but they don't meet the guidelines. So the next question is on physicals. Yes, we can accept physicals done in other states too. And that if the physical they have in their admission packet is from when they entered kindergarten, even if they're starting a higher grade, that it still counts. Yes, it does. So you might have a 5th grader transferring in from another state, and they had a physical for entry into kindergarten. Does that count? Yes. And I will tell you personally, it was very difficult for me because we came from military schools when we moved to Virginia, and they were required at that time, this was a long time ago, but to have a physical every year to start school. So it was really quite an eye opener when we came to Virginia and their last year's physical counted. Like, oh, that's interesting. Let's see. School requirements for CPR, that 2 additional people beside the nurse need CPR. Could we clarify the annual requirement? That's actually in the code of Virginia, that 2 people in the building have to be certified in CPR.
Now, we do, in our division, we use American Heart Association.
Yeah.
Certification is good for 2 years. And we have gone before where we have reviewed from year 2, but the American Heart says you don't have to, that it's good for every 2 years, the certification. And so that's what we go by. If somebody wants to review every year, we certainly will give them a review.
Yeah. And we've done that with AEDs review too.
Yes.
Is that maybe an annual review of the AEDs, although the AEDs are getting even easier.
Right.
Frequently, if you just open them, they'll go through all the instructions.
Yep.
Yes. Okay. Our annual pediatric physicals, sufficient for school entry. You know, we said review of systems. If it says a review of systems, then generally it can be accepted. And the instructions on the MCH 213 will say that specifically. A lot of times, what I have done in the past is, emailed a blank copy of the MCH 213 to the parents before they go, or even handed it out and just say, have your pediatrician, your physician do that. I do know when we used to do free physicals for incoming kindergartners into Fairfax, that was actually the form that the physicians and nurse practitioners and PAs used, because we just had the MCH 213 ready for that. Okay. All right. Do we have any other questions? It's 11:26. Thank you for the questions, and yes, all the things where everybody answered that yes, they could hear us. Thank you for that too. And thank you for your patience of putting up with this. And we are thoroughly enjoying these comments, et cetera. And as we said, this isn't our choice of the way to teach, but this is what we're given. So we will continue and hope everybody got a nice little break, and then we'll just keep going. All right, Becky?
Okay, if you can move to the next slide, please. Okay.
I'm going to be really upset with
So about the trainings that are mandated. So the CPR, the anaphylaxis, and I'm going to switch this up and talk about diabetes first. So diabetes and emergency glucagon training is required by law for designated staff in a school building. You have to have at least 2 people, here we go again, 2 people, not including the nurse, who are trained in diabetes glucagon, emergency use of glucagon. Now, that being said, any employee in the school division can turn down medication training of any sort. They can say, I'm not going to give it, except for your administrator. An administrator serves in loco parentis, in place of the parent. They may not refuse to give medication. And that means they would be responsible. If they're the only person there and you've got a student with a diabetes situation and there's no nurse there and there's nobody else, let's say the other person that was trained is not there that day, guess who it falls on? The administrator. So the very first thing I want to say is, when these folks get lined up to be trained, one of them should be your administrator. Now, that could be an administrator, a principal, or an assistant principal. It doesn't matter. It's got to be one of them.
We've also had schools where it was the number 3 person who, if both the AP and the principal are out, for instance, the counselor, but it's whoever takes over that school when the principal or assistant principal are absent. If they count as the administration team, those are the ones who cannot refuse to do it. So that's why you try and say somebody has to be here at all times.
So the very first thing you look at when you think of this training with diabetes is not who are you going to train, who do you have that has diabetes? What students do you have? What grade levels are they in? Who are their teachers going to be? And that's where you start to build your base of who needs to be trained. So best practice would be the student's teacher or teachers, if they're in middle school or upper elementary or high school, if they can be a part of that training, that's ideal, because they need to be able to recognize when something's going south with that student, and know at least to get them down to the nurse, or call for the nurse, or institute some emergency help if that student is carrying some supplies in a string bag with them or whatever. So that's the first, is know who your students are, know who their teachers are. Then you build around that and think, okay, who else is going to need to know this training for this student this year? Well, probably if they're in PE teachers are going to need to know, and that could be that student's PE teacher, or school may choose to do all of the PE teachers. It should absolutely needs to have an administrator built in there, and that may be the group of people that you have trained every year. It just depends on the student and who is working with them closely. You want those folks trained in diabetes. Now, when you gather them together to train them, there are lots of different kinds of training. There is a program out, which I hope every school division gets to take advantage of, because it is very good, called Learns. And you all will learn more about it somewhere along the line. And it's Learns in capital, LEARNS. And it is a diabetic education program underwritten by Lions Club International. And it's got multiple modules to it, from as basic as diabetes awareness to all the way out to very specifics on insulin pump work. But there are programs embedded within there that some school divisions use to do training. Again, some schools develop their own training. They develop their own set of slides and hands-on practice, and they use that. And there are some already pre-populated diabetic trainings that school divisions are involved in. So it doesn't really matter which one you use. You look at it to make sure that it is a sound program that supplies your staff with the information you need. And they are the folks who are willing to provide emergency treatment for a student with diabetes should the school nurse not be available. Always, if you're available, always, if you're available, you're the one called. You're the one dealing with it.
Yeah.
But what happens if you're not in the building for whatever reason? You're at another school, or you're out sick that day, and there's an emergency. Who's going to cover for it? Well, maybe you have a substitute nurse. Maybe you don't. I hope not, but maybe you don't. They're scarce as hen's teeth nowadays. So you have to have folks that are willing to be trained in this. And this training is done on an annual basis, and we have to have it because state law requires it, absolutely requires it. So be thinking of that. And if you are brand new and you have no idea where to start with your students that have diabetes. So let's say you've got a school with two students with diabetes in it. Probably all your PE teachers are going to, or any PE teachers you have are going to automatically be trained, and you bring in all those staff, including the administrator. You can do them all at one time if you can make that work, or you can do them at 2 different times. It doesn't matter. It just matters that you do this, and it is best to do it before the start of school, so that they know when that student walks into their classroom, kind of what to anticipate. Now, that being said, I want to tell you, what do you do when you have a student who's diagnosed mid-year, as often happens, especially in middle school? Well, you start with the student, who their teachers are, and you may do a training right then, a day after school, and you gather those folks together and say, you all need to be aware of this. They can take that training, and even if they say, I don't ever want to give this, but I want to learn about it, they, because they just do, they could come, but their name might not be on any signature line anywhere that they've agreed to do any kind of treatment. We cannot compel them to be treated or to provide treatment. The other thing I want to say to you, and this is really important, field trips. By law, somebody
Yep.
in diabetes emergency treatment must go on that
Wow.
with a student. If it's their parent, fine. But if it's not, it's got to be somebody from school, and they've got to be willing to the diabetes. And oftentimes what we did, because nurses don't always go. It's rare that nurses leave because they still have a whole building of students. They don't go out with one class to a field trip. But sometimes you make it work really well, especially in middle high school, where you, the nurse works with the teacher. The teacher's with the kid doing their blood sugar, and they're on the phone with the nurse, and she's hearing the information, and all is well. There's no issues, and that works okay. So there are lots of ways that schools can work this out, but their treatment has to be the training has to be in place, and folks are signed off on that, and that's an annual training. Up above that, I'll talk about seizures. Depends, here we go again, depends on the students you have and what their seizures are like. If you have students that have active seizures, they have cluster seizures, or there's students who have got Diastat ordered for them, you know that you're going to be needing to do some training with the teacher, work with them. This is what it looks like. Here's what you do there. And some teachers, especially teachers of students who are medically fragile, who have multiple seizure exposures or situations, who are in self-contained classrooms for the most part, most of those teachers get trained in Diastat, because there are going to be times when they're going to be the person right there to give it, because a nurse may not be even on site and the child needs the Diastat given. So it's very unique. It's case by case situation, but when you have students who have seizures that that might occur in school, the parents have told you that might occur in school, you definitely need to have staff that are trained to understand it, be aware of it. And again, if you're there, you're doing the treatment, you're doing the assessing and the treatment, you're pulled in right away. But what happens if you're not there? What is their next step until they get some emergency help in place for either one of these areas? These are our big areas of concern always.
Do you want to see if the links will open? I sincerely
sure.
hope so,
Let's
'cause
open them up. Now, diabetes, when we talk about diabetes, see that one that says medical management plan? If we can open that up.
That better. Okay, this is the Virginia Diabetes Council. And if you can click on the diabetes in schools.
Yep.
Well, I don't know why it's being. There we no. Oh, that's interesting. It gets to the website, but we might be able to scroll down. That's,
I don't know if it'll. Oh.
yeah.
It is, folks, it is a big document, probably
Yes.
9 pages, front and back.
There we go. The diabetes medical. There we
Here
go.
we
The
go.
diabetes medical management.
Here we
plan.
go. Click on that DMMP, that very first one. Well,
And this is new for this year. They
there it
updated it.
is.
Yeah.
There it is. Thank you. And
This
it's
will be filled. Yeah.
document. Now, some endocrinologist groups use this exclusively. Some endocrinologist groups do not use this document at all. They use their own document, and
Yep.
it has the same information.
Yep.
We accept it. And you can see this is very detailed, and it deals with the baseline.
Everything.
It deals with hypoglycemia, hyperglycemia, use of glucagon, insulin pumps, permission to administer, the management by the student during the day. It goes on and on and on. It's very detailed, and the physician completes it every year.
Yep.
And on those visits during the year, like if they're if they're every 3 months or every 6 months, they'll send you follow-up orders, particularly if they have adjusted rates and ratios, carb ratios, tighten things up, or if they've moved this child from an insulin pen to a pump. You'll get a lot of new documentation, but it is very detailed and an excellent document to
Yeah.
use. Very, very good.
And the people, the two, the certified diabetes educators that are on the Virginia Diabetes Council, Jackie McManaman and Nancy, I believe, are outstanding. Truly, truly outstanding.
That's Nancy Markley, isn't it?
No, Griggs, I think it is. They're both, Jack is a CDE. So
Okay.
they are truly outstanding. And then we have the supplemental form as well,
Yes.
too. So there you've got for your adjustable insulin therapy. But, you know, this all is, the caveat is there, do you have a student with diabetes in your school?
Right.
And the one thing I would also like to add, and I know we sound like we're kind of stuck on it, but this is a big thing too. When Becky said, if you have a student that is diagnosed throughout the year, they usually stay in the hospital like 24 hours now. And
Right.
they are told, the parents are told right away, well, you know, just you can get them back into school. So you may be running on a panic mode of the parent wants that student in school right the next day or something, but you have to have that training somewhere.
And what I have found, and I can't remember the last year that we did not have somebody diagnosed
Yeah.
somewhere in the
Yeah.
division. And what I have found is as soon as we find out about it, that nurse is talking with the parent, and the very first thing they do is say, we need to set up a meeting with you, the parent, to go over our plan for school before your child comes into school.
Yeah.
You need to know what to do. I would say 100% of the time the parents say yes, because they're so scared. They're so terrified. They're trying to figure out and get used to this. And they're really scared of sending their child back. And so if you have a meeting with them and you go through step by step,
Yep.
all the things you're going to have in place to support that child coming back into school, it really makes their transition back in easy. And then, of course, there's just constant daily, multiple times a day, phone calls, working with that parent, educating them, reassuring them, as well as working with the student. But it works well. If you get that meeting set up first, it makes the rest of it flow. But that being said, at the same time you're doing that, you're lining up training for your staff. There's no wait on that. They have to pull together quickly. And believe me, they want to too, because they're nervous about it also. They want to learn about it, but they also want to know what they're supposed to look for, and they want to know what help is there right away if there's a problem. So it's not only educating them, but it's also reassuring them.
I would also just say, diabetes is going to be a lot of your case management. And you're going to have very close relationships with these families as well too. But I will say personally that I find it very, very satisfying because you learn so much. And at the very beginning, if you have a student who's diagnosed in the middle of the year or two, they may not have any idea of what their symptoms of hypoglycemia are because they've been running high for the last several weeks, probably. So you as the school nurse are really intrinsic in helping that family and the endocrinologist know what those symptoms are, because you're probably going to be the first one to start seeing them.
Correct.
And you educate the student and you educate the family as well too. So I'm just throwing that in, that people get scared about it, but look at it from a nursing standpoint. This is truly, you are making a huge difference.
Yeah.
In lives.
Sorry. Our goal is always to try to avoid having a student get to the point where glucagon is even considered.
Yep, that's it.
Prevention is the key to this.
Yep.
And so that means when a student comes into you, when they're newly diagnosed, you keep really tight reins on them. We saw them probably every 2 hours or every 1 to 2 hours in those first weeks when they're back, depending on how well they're doing, just to see how their body's managing this disease process. It's the only way you're going to know what they're like is if you're seeing them those blood sugars frequently. And once you get a handle on it, then you can help even more. It's easier to loosen up the reins later when they become more stabilized than it is to be kind of loose in the beginning and then try to tighten up later, because it takes a lot of work, but it is one of the most satisfying parts of school nursing is the case management of a student who is diagnosed, and then where you see them progress to in managing this disease so that it is just a part of their life. And life goes on for them as normally as possible. So that being said, so those are that are individually based trainings. And now if we can move on to the next slide. And here, okay, now we have to talk about this part a little bit. There are some trainings that are coming that the Virginia General Assembly passed laws this year, or last year, and this year is coming. So last year, there was biannual seizure training that became mandatory for school nurses. So our school nurses did this last year. They all took this seizure training last year, but you now have to take it every 2 years. There will be other school nurses who will be taking it this year, but it is every other year. And then there will be also seizure training mandatory for school staff. And I don't know quite what that's going to look like.
It's going to be probably based around the Epilepsy Foundation for school personnel, just like ours is for the school nurses. But remember, this is not mandated until next school year. So
the
we're just
seizures
letting you
for
know.
employees, the seizure training for employees.
Yeah.
And the Epilepsy Foundation is where our nurses get their seizure. They have an excellent training for school nurses, specifically designed for school nurses. And there's certification attached to it, and there are contact hours attached to RNs.
Yes. So it's free through CDC. Okay.
Diane, will you speak one more little bit if you need to the asthma mandatory training?
That is going to, the training is, that's going to be for stock albuterol in the schools. And that will be January of 22. And as we said, we are still developing that training because it is stock albuterol, and it will be for both the school nurses and for school staff as well too. And private schools, we don't really necessarily address this, but this is, if you receive federal, any sort of state funding, I would assume you're going to have to follow these as well too. So those are the two General Assembly things that are coming up.
And of course, we talked diabetes, and I want to go back and just say one more time about field trips. If a field trip is set up and there is no trained adult, the parent cannot go, and there's nobody else that will go, that means that student would not be able to go, and that will not fly. The field trip gets canceled and rescheduled until you have an adult who is trained, a school employee, not just any adult. I've had questions before where somebody said, well, so-and-so's mom's going and she's a nurse, can she do it? No, no.
And you cannot ask the parents to go.
No, you cannot compel a parent to go. You can ask them, do they want to go? And if they say, sure, I'd like to, that's great. Or they'll call up and say, can I go? That's great, but you can't compel them to go. And that means the school system has to have somebody trained to go. And I speak to this because this has happened before. People set up field trips. They don't say a word to the school nurse until the day of. I've had that before, or the day before. And we know there's a student that's going to be on that field trip that has diabetes. And we just wouldn't even think of sending them without somebody trained with them. And We've only had one time ever where we canceled a field trip, and we canceled it because the teacher did not do what he was supposed to do in taking care of this in advance, which all he had to do was talk to the school nurse and let her know as early as possible, this is the field trip we want to go on. And the nurse would have then worked to try to make sure we had somebody in place. And that field trip got canceled and rescheduled. So it is a big deal because it is a law. It's not a regulation, not a recommendation, it's a law. And if something happened, it would be a big old fat lawsuit from the parents against the school system, no question about it. Okay, and the last thing I want to speak on trainings, and of course, this one also is very individually based. Oh, not the last one, I got one more after that, is adrenal. If somebody has some type of an adrenal related diagnosis and they are ordered Solu-Cortef. And Solu-Cortef, as you know, is a two-part deal. It's a bottle with a powdered solution in it. It is a syringe where you have to mix and then redraw up and then give. It's not been changed. It's kind of like glucagon, but it's got an extra step in there even than glucagon. And it really is individually based. It's whenever a physician orders that and that student carries it with them at school. Here we go again. The teachers that are going to be working with that student at least need to be trained on it, particularly for a field trip. If a parent can't go and the nurse can't go. It doesn't happen very often. We don't see this real commonly, but it is there. So I want you to be aware of it. Also, flip back up there to seizures. See that diastat piece? Definitely diastat training for whoever is going to be working with a student with multiple seizures. And that means think about school buses. If students are on specialized transportation, they're driven in a car or a special ed bus, or they're on a regular bus. If they're carrying that diastat with them to and from school every day, somebody on that bus has got to be trained to give that diastat should they have a seizure while they're being transported to or from school or on a field trip. So the same rules apply, and we work very carefully with those staff on an individual basis. I will say they've come out with two new nasal inhalants of diastat, which is just wonderful because now you don't have to disrobe anybody, and it protects privacy. Taco, tell me the names again.
Valtoco,
Valtaco.
and the other one is.
Well, it starts with an A. We haven't gotten any
No,
in our
N.
division. Not nasalem.
Yeah.
Yeah, we haven't gotten any in our division yet, so I'm not real familiar with those names, but we will be once we start getting those orders for that instead of rectal diastat. Okay, I think that's it for that section. If we can, Diane, do you have anything to add?
Nope.
Okay.
No.
And so now, well, look at that. I already talked. I already covered this slide.
You did.
Because that's all the, that's where you find, there are training manuals for diabetes. There are big manuals.
We'll show them
That are set up. I think you can click on that, right? On the school health.
Yes. Yeah, and we'll go through that towards the end.
Okay, we can go back out of that.
Yeah.
There's like 3 or more. There are
we got a bunch of them. Yeah.
Of supports, and we've already talked about requirements. We've already talked about refusal, and and who trains staff. All of these trainings are by RNs. All medication.
Yes, that is the law. That is written
law.
into the Nurse Practice Act and the Code of Virginia that the trainings have to be done by RNs.
Now, if you're a school where you are the LPN and you are the nurse attached at school, you can certainly be there and help. These are the staff that you work with, the students you work with. RNs certainly want to be working together and do work together with that LPN. They do those trainings together, but ultimately the RN is responsible for the training and signatures, etc. Okay, we can move to the next slide, please. School nurse calendar. Okay. I would like to tell you that every division has a school nurse calendar, but they may not. And when I say a school nurse calendar, can we flip on NASNs?
Now, this is more detailed than a lot of schools
Right.
have, but again, you
It's-
take what you need
You
and
exactly.
you leave the rest.
What we do is you start your school year, you just take each month and you look at all the required things, the mandated activities that must take place in that month, and you put them in first. And then you add in other things that you may do that are unique to your division. Now, they've done it this way with leadership, this whole framework piece.
Yeah.
We don't have that. We just have a school calendar for each month. These are the things that a nurse needs to make sure she is looking at, taking care of for that month.
Mhm.
Nurses do look at it. They don't write on it. They don't put notes on it. They don't do any of that. They just take care of the activities. But you will see school calendars are really top heavy, starting up, opening up a school. So whatever that is, August, September, lots and lots and lots of things
Yep.
that get done. And then it smooths out over the late fall and winter months. And then you get to the very end of the school year where you're closing out the school year and you have some more activities then, but they're not as labor intensive as opening the year. Opening the year is a challenge and it's tough. Get through it and then you can ease off a little bit. So you check and see if does your school district have one and look at it. It just gives you a framework to start from to make sure you're addressing everything that's in there, that you're at least aware that that's a requirement and you're addressing it the best way you can.
And also check with if you have friends in other counties or reach out to us at the state too, because I
Sure.
know Tracy, we have from lots of other counties too. And again, you'll look at several different examples and you pick what you need.
Yes.
Because these calendars are basically kind of suggestions too, except at the very beginning of the year, as Becky said, where it's so heavily weighted.
Yes.
So, okay.
Okay, we can flip back out of that, please. And then I want to tell you also, keep your own calendar, whether that's a leaf through, a big 8x10, whether that's a desk calendar that you keep, whether that's a little one of these little guys. I have both. And our division is Google Calendar. Our division is Google. And so I have a Google Calendar too. You're going to be asked to do lots of things. And you need to make reminder notes to yourself, maybe about certain student situations like immunizations, et cetera. You need someplace to keep all of that. So a regular old 8x11 calendar, that monthly reminder that you can flip through, that's got sections in it where you can take notes on meetings that you've had to attend, anything like that that will help you. That's really necessary just to keep your mind sane. You can look at, what do I have for this week? What do I have for this month? What have I got tomorrow that I've got to do? What have I got today that I've got to remember to attend? This meeting, that meeting, etc. So that's I know that's a good piece of a tidbit for you all to have.
And we're not saying that we're not being old school and saying that a hard copy is necessary, but you have to consider all of this. What happens if your internet goes down?
Right.
And I can guarantee you, probably every school division has had that happen.
Yep.
And with diabetes alone, if you're doing carb counting and you can't access what the menu is and such like that, you have to be prepared for if you lose the internet.
Yes. And also if people say, well, I want to just use my Google Calendar, well, you can't necessarily put children's names. You can't put children's names in Google Calendar. That's not its purpose. So it's more for meetings, trainings, that kind of thing. It's not meant to be a personal calendar for your school day where you're interacting with
Yeah.
students and teachers. Also, student days versus non-student days. Do you have to work non-student days? Now, that is division driven. So it depends. You need to find that out. What kind of a contract I'm on? Am I here when teachers are here? Am I here when teachers are here plus other days? Every division has its own set of criteria for when it wants school nurses to work. Check with the other school nurses in your division. If you haven't already had this in orientation, I'll bet you've already had this at the very beginning of any kind of orientation, so that you know what to do. And that also goes for inclement weather, going home early. It's all of those things where the normal routine of the school day is interrupted. Check with them because they're going to be able to tell you. Okay, we can move on, please. Okay, annual health history forms. Now that sounds scary, but let me tell you what that is.
Yeah.
At the beginning of each school, parents have to register their children back in for the next school year. Kindergarten, they're registering to enter into the school system, but after that, they register to return each year. And that's where they're supplying, what I talked about earlier, all those demographics, names, addresses, emergency phone numbers, etc. Some school systems do all this electronically. And our school system does it electronically. The parents do all that registration online. We embedded within our registration the health history. So every year, parents answer questions electronically about allergies, medications, medical alerts, medical diagnoses that they want us to know about, or health issues with their child that they want us to know about. Do they wear glasses? Is there a history of concussions? There's all kinds of questions that we have that parents fill in each year, and then the nurses take that information and we make sure that we embed it into that student's health record, which is electronic. So that we have all that information for that child, and that it's updated annually. Now, some school divisions don't do it through electronically. They still do a paper pencil, and parents fill out those forms on the first day of school every year. No, when I was in elementary school, they didn't even do any of that. It didn't exist. But as early as 10, 15 years ago, it was all paper pencil for just about everybody. You filled those cards or sheets out on the first day of school and you turned them back into your teacher. And that's how nurses had that information to access when they needed to contact parents and to know about health issues with their child. So you may still have it that way. Either way is acceptable, but you got to have some health information on that child each year, if at all possible. There will always be parents who do not ever complete.
Yep.
They never update anything. They never turn in anything. They don't do it. They won't do it.
Yeah.
They won't do it. So if you ever get to 100%, you get a great big gold medal because you deserve it, because most everybody never gets there. Now, staff's a little different. Some staff have to fill out that health information every year. Some staff do not. It depends on what the school division asks of them. They usually have to have emergency contacts.
Yeah. Okay.
Okay?
Yeah.
All right, we're on to the next one. Okay, this is another big issue. Medications. You are going to give medications every day. Most of the time, it is going to be pills, but there will also be inhalers. There will also be medications, and there may be back off.
Yeah, don't do that.
Nebulizer treatments again this year. We just put that back in. No nebulizer treatments. We did those for a long time, but not now with COVID, where that's not on the docket. So most of the time, that's what your medications will be. Some of those will be pills, and for elementary kids, you will have liquid format. Medications are one of two directions. Either a parent can fill out a form, if that's what your division has, for a non-prescription medication, an over-the-counter medication that they want their child to be given at school in case of fill in the blank. A good example, a child that's getting braces, and the parent wants to have some Tylenol there for them when they have braces pain. There's a form, should be a form that a parent completes. If that school division doesn't have a form, that parent may write a note. That's happened too. That's one way. The other way is prescription medications. And that can still be an over-the-counter medication, but a physician has ordered it. We have physicians that order Tylenol. Absolutely. So then you have a physician's order form that is signed by the physician or the healthcare provider. So that could be allowed, that could be a nurse practitioner, that can be a PA or physician. And the parent signs it too, and they stay on file. So either way, you have to have written permission from a parent, and in addition, written permission from a physician if it's a prescribed medication. So there is written documentation in the school building for every medication that's given. There should be nothing given that does not have that attached to it. Now, where do we keep medications? I would like to hope that most schools have a medication cabinet that is locked, because any of your drugs for ADHD are all scheduled drugs. They are required to be under 2 locks, and 1 lock is your medication cabinet, and 1 lock is probably your clinic door. If it's locked, should be 2 lock, a double locking system to get into the clinic and then to get into the medication. You should have a tracking system for all of this. Not should, you have to have a tracking system for all of this. So let's talk about that a little bit. Some school systems still do this by paper pencil. They have a medication log that the nurse sets up for that child. And every day when that child takes that medication, the nurse initials it, and oftentimes the time that it is given. Some school systems have an electronic system, and that when that medication is given, the nurse enters it electronically. Either way, you've got to have some accountability for medications that you give at school. You've got to have accountability for how much of a medication you received. You've got to have an accountability for notifying the parents that you're getting low and you need refills. You have to have an accountability for all of that. And so in our division, I will tell you, we're still paper pencil, and we're not ready to move to electronic yet. Our nurses like having that level of control with it. They take a lot of notes. They have a medication log backed up by notes, medication notes, backed up by the physician's order. And so it's all in one place, and they have these all in notebooks that are individualized for each student's name, a file within each notebook. You all know what I mean, like an index, and then that information behind it, because some of our nurses are giving 40, 50, 60 medications a day, between insulin and ADHD medications and inhalers, sometimes close to 100 a day. That's a lot to keep up with. So you have to have a very organized system set up. Now, if you already have one, great. If you like it, great. If you can see there are parts that are missing on it, that you don't have that accountability, that's something you need to work on, because you really need to be accountable for every medication that you have in your building. Orders and chart, and I've kind of just talked about that the orders have to be on file and associated with it, with the prescription medication, and how you how you maintain those. Some nurses do like almost like an MAR system. There's all kinds of different ways. It doesn't matter what it is as long as it works for you all. Now, retention in the cumulative file. Do we want to open that records retention up? Or do we need to?
I think we, just for the time, we might want to move on.
Okay.
Because the records
So-
retention, yeah.
Okay, so we're going to talk about this. Medication orders, anything associated with that medication has to be retained with school records for 5 years after the student graduates, or transfers or withdrawals. But we usually just mark it 5 years post-graduation, or when they were intended to graduate. These cannot be destroyed. After that, it changes, but it includes all kinds of other information too, as you can see in there. Medication administration, physician's orders, lab work, reports, nurses' notes, homebound, IHPs, which are individual health plans, medical information for eligibility for special ed, and anything that has to do with an IEP that the nurse might have been associated with. All of that information gets retained. Pretty much everything you do gets retained for 5 years postgraduate. Okay. Now, if you're doing over the counter, did you speak to that?
Oh, no, we're just saying with over the counter, there have been some questions in the chat room about, do you need a physician's signature on that? In some school divisions, you need to check with your local school division. Some of them have a time limit on it too. Same with
Right.
the medication forms. And we will get to that link later that is in the school health office. The training for medication for unlicensed personnel has been updated, and the link is there. And I would strongly encourage all of you to read that. It is very detailed, because we're just trying to touch
on.
literally touch on these, because we know that we have 45 minutes left. So
I won't say so much. I'll go faster, but I want to say you have some school divisions who do not accept any parent signature for over the
yes,
medications. Everything is physician ordered. So if that's what your division does, that's fine. Okay, let's move to documentation. You need to see how that is. Hold on, back up one. If you don't mind, back up one a minute. I want to make sure I covered this.
yeah,
Documentation, follow what's already in your school. Accountability, we talked about. Wasting. If you have wasted medication because it drops on the floor, it's gotten wet, or the kids spit it out, you have to note that and give them another. And I would say you call the parents and
mhm,
know what happened, because they're going to be a dose short.
Yeah.
Let's say you gave the wrong medication by accident, and that
that's
happened.
for human.
Beat yourself up. Something happened that you just gave the wrong kid's medication, and it could be the exact same medication, but it came out of another child's bottle instead of this child's bottle. There is a form, there is a state form that you fill out that stays on file. Your principal has to be notified. The parent has to be notified. The physician that ordered the medication has to be notified. And the school nurse, coordinator, supervisor has to be notified, and will want a copy of that. That happens, but very rarely does anything bad happen from it. So just know that accidents can happen. You just be honest and say, I did this by mistake. It doesn't mean you're a negligent nurse. It was just an error. And then, of course, consent to release information. For us, our physician's order already has that embedded in it that says we can talk with the doctor back and forth about medications.
Yeah.
But not everybody has that. Some have different forms. Okay, now if we move on to the next form or next slide, office visits. Again, I'm going to touch on this. Every division is different. Some still do pencil paper, some do electronic, but I will tell you, look at that bottom line. If you don't write it, it wasn't done. And that is so important. Now, there's some information you aren't ever going to write. So I'm going to give you an example. So-and-so comes in and says, my dad beat me with the belt last night. And here's look at my back, and you can see the belt marks. If you put in your documentation, Johnny reports, my dad beat me with the belt last night, and then you referred to CPS, you heard that and you did that. But if you put that in there, the parent has access to all their child's records, including all their clinic visits. The parent see who reported them to DSS. I don't want that, but you want record of that. So perhaps you put in reports, my back hurts, and you report what you observe. You know, three bruises, inch wide, 3 inches long, a mid back, however you want to write that. And then you write, what did you do about it? Referred to administration. You know, for a while with a cold compress, referred to administration. And then you go on in a separate place. If you want to make notes that you keep for yourself that are not part of the student's health record, you can do that. You can write some notes to yourself. They're just not part of their record. Concussion visits. I want to speak to that quickly. If children have head injuries in school, if it's anything more than a slight bump and that's your discretion, you probably ought to be doing a concussion checklist. Even if it is 0 and it's all fine, it never hurts you to do it, to take the extra minutes to do it, and let a parent know that they had this head injury, you did this checklist, here's where they are now. Want to make sure you know, because that parent may say, I'm going to come pick them up, and they have every right to. It's better to err on the side of caution than to ignore it and have a big problem blow up in your face. Same thing for accidents and incidents. Incidents are when kids get in fights, and almost always the principal is going to be talking to the parent. You may be adding health information about it, but they're going to be calling. Accidents, they go from minor to major. The very minor, tiny little things, no. The more significant things, any kind of sprains, strains, cuts that you know you need to let them know. You think, would I want to know this about my child? Then call them and let them know, or leave a message for them. There are some parents who want to be called for every single time their kid comes into the clinic. Pay attention to that and call them every single time their child comes to the clinic. And they will tell you later on whether they want you to continue to do that or they want to save that for just the very important things. But you will have that. Okay, next slide. Please. Thanks. Okay, there's all kinds of emergencies, potentials in schools that we have to prepare for. And you can look down this list and see them all. School divisions have protocols in place, procedures in place for how they're going to treat each one of those emergencies. They have to practice them, every one of them a designated number of times per year. And that's when you see down there to the emergency drills, that's what that is. And you will participate in theirs. You have to ask, here we go, your school administrator, what they want to go out of the building on a drill. Do they want the medication cabinet to go? Do they just want the emergency go kit, which is could be any number of things. It's some kind of a container, a backpack, a tackle box, whatever it is that contains a certain number of emergency supplies. Do they want that to go every time? Do they want emergency meds to go every time? Your administrator will tell you what to take out with you on drills, because lots of drills. I will tell you, the first month of school, there's a fire drill every week.
Yep.
Required, first month.
Mandated by law.
Once a month. So know how to call for EMS systems and what your school division wants to do. Do they want you to call the administrator? Do they want you to call the office and have the office do it? Are you allowed to call it yourself? I think everybody is 911. I don't think we have any places in the state that don't have that, but know how the protocol sits in your building for contacting your emergency services. How your administrator wants that done.
And I would also say in your health room or clinic, whatever you call it, is make sure that there is a hard copy posted somewhere with how you call 911 and the school address as well too, because For instance, if you have a sub in there, or say a volunteer and somebody else is calling while you're right there, it's just so you know the address of the school.
Right.
Okay?
Okay.
Yep. Thank
Slide,
you.
please. Health alerts for teachers. You all, I would hope everybody confidentiality that you have to maintain, what you can and cannot say, who does and does not need to know, and know the 6th grade teacher or the 3rd grade teacher who is the next door neighbor of the child that's in the clinic, but doesn't have that child as a student, does not need to know what's going on with that child, even though they may come ask you. You have to guard the confidentiality of your students' health needs. That's not to be shared except as need to know basis. Okay. Diane, was there anything else you wanted to add for this?
Nope, I think we're good on that. Thank
Okay.
you.
On the Padlet, you will see
Yeah.
for when to stay home. We're not going to address that because you can see it by accessing the Padlet. Wash your hands a lot of mitigation's gone away this year, so mitigation strategies, but that one stays and is always a good one. Okay, and if we can slip on to the next one, please. Substitute nurse plans. Every division should have substitute nurse plans in place. Ideally, they should be in each building. Ideally, they should be consistent throughout the division. The substitutes sure appreciate that. And those subplans include all kinds of information. You can see here the map of the school, the schedule of the school, the health problems with the kids, who gets meds, when they get them, who is a frequent flyer, who needs to have their parents called. All of these things are in there, and nurses, the nurse is to update that substitute plan, especially when she knows she's going to be off. But if she doesn't know and it's an unexpected absence, that would be updated at least monthly. And for sure, maybe more often than that, but at least monthly. So look for this in your office. And if this is not something that's going on in your school or your division, might be something you want to bring forward at some point. Okay, if we move on to the next one. And these are just more things. This is just more information that's in the substitute nurse plans, medications, allergies, that kind of thing. And we always tell substitute nurses, any questions they have, go to the secretary. She can help them with everything. Now, if you see in here, it talks about computers going down and access to computers. Not all divisions allow their substitute nurses to be on their school division computers. That does not happen everywhere. And so they have to refer, they have to have paper pencil phone numbers, or they work with the office secretary if they need to call a parent or send somebody home. So some allow computers, some don't. Okay, next slide, please. Concussion protocol, we talked a little bit about that when they sustain injuries. Return to learn, return to play is the current initiative that we have in this state that has, you just need to be able to read it and understand where you fit in it. It is getting ready to change to the Virginia Concussion Initiative that will replace it. And that will have a lot of information that will be helpful to you. And I'm not sure when that's going to be presented, perhaps this fall. I'm just not sure yet, but that will give school divisions, it's just more training for them. And that's where nurses will get updated with all of that training, as well as what we have built into our systems, the Virginia Concussion Initiative. Anything else, Diane?
Nope, not right now. Thank you.
Child abuse reporting, you all know, I hope
Yeah.
you are mandated reporters. If you see, hear something that raises your radar, it needs to be reported. Now, each school may do this a little differently. Your administrator, go to your administrator, and your administrator will direct you as to how they want those calls managed. Sometimes it's the administrator is there and the nurse calls, and the administrator's in the room with them. Sometimes the nurse calls on her own and the administrator gives permission for that. You work that out and follow the directives of your administrator. all child abuse that is suspected, has been reported by that child or seen, observed by that nurse, has to be reported within 24 hours.
Yeah.
Don't have wiggle room on this anymore at all. There used to be more, not anymore. You do it quickly. If it ends up not being an issue, that's not your concern. You called in because you saw something that concerns you. If it doesn't get founded, that's DSS working with that. That's not any more problem with yours. Now, how do you interact with the student and what do you ask? Oh, you could talk about that forever. When they tell you or you see something, some students will be honest with you. Many students will hedge. They'll give you an answer that just doesn't make sense. You can ask a little bit more questions, enough to get a sense of what was going on. And then that is what you report to Child Protective Services. They will do more asking. They will do more in detail. That's really a case by case situation. You have to see and hear what's going on to know what more to ask. Diane, any more?
No, I think we're,
Headlights, our favorite.
yeah, we'll just touch on these.
Yeah,
'Cause I know you
headlights,
need
it is looked
Yeah.
at now as a community issue. It is not looked at as a school
It's-
problem. We treat it differently. Kids stay in school. They do not lose instruction over headlights. Live lice, maybe a little bit till they get them killed. But after that, they are in school. We do not want them out of school, and your school system should have a protocol for all of that. Okay? The next slide, please. Health records are protected by FERPA. You all know that. It's part of the cumulative health record. Some schools keep their health records in filing cabinets, their cumulative health records in the clinic. Our divisions do. They stay right in the clinic in locked filing cabinets, and they revert back to the cumulative record when the child graduates or leaves the building. But other school systems are different.
Yeah.
So you have to go by what your school system says.
Yes.
Next slide, please. We talked about this, AED,
Mhm.
epinephrine, there are required checklist on them to make sure for quality control, to make sure batteries are still going, temperatures are correct, epinephrine's okay. You should have those in your school and you just follow those protocols as to weekly, monthly, quarterly, whatever they are, and document.
And you may not be responsible for checking
Right.
the AED and the epinephrine. That may be
Somebody
just-
else may
just-
have that
yeah.
responsibility.
A lot of time administrators are the ones who do that. And if they do it, don't necessarily offer to pick it up because you've got enough other things to.
Yep. Yep, okay, next slide, please. Workman's comp, this
Same thing.
about in your school. We're not going to talk about this
Yeah.
because Division has their own system set up.
And they may have somebody else who's
Who's managing
responsible
it,
for
right.
it. Yeah. Because technically that's not you. Yeah.
Correct.
These are the VDH guidelines. These are just that going to link you to those sites too. We're not going over that right now. But these are the whole thing for the recommendations for school that VDH has put out right now. Okay. Next.
Medicaid billing, we're going to do this at another time. So
Yes.
stay tuned for subsequent trainings because we're going to have one that will deal directly with Medicaid billing later on this year. Okay, next slide, please. Okay, now we're going to go into this final piece of, we're going to go into special ed, I think. Individual health plans is a separate unit. We'll catch that later, and emergency action plans is a kind of a separate thing. We touched on that some, but special ed, we're going to touch briefly on this. If we can go to the next slide, please. No school tomorrow.
Yeah.
That's a nice one
Take a
to
breath.
hear.
Take a
Okay,
breath.
next slide, please. All right, now I'm not going to read all this, but I want to see if we can forward through these, Leland, please. This one. Keep the next one, please, and the next one. That's the overall
Yeah.
overview of the nurse's role in special ed. Now, we are going to do a specific unit on the role of the nurse in special education at some point in this year that we
Yes.
want you all to take part of, because the role of the nurse is surely increasing over the years. We sit at the table now and there is a lot of responsibility. So I'm not going to do a whole lot with this today, except to give you some brief, very brief, because you're going to be starting on this when you go into school, and we want you to have at least a little bit of information. So special education has been around for a long time, and it is instruction, specialized instruction to meet the needs of a child who has an identified disability that requires them to be taught in a different way than their peers. Next slide, please. Purpose is because a law requires that every single child has the right to have a free, appropriate public education. Children who need to learn in a specialized setting, specialized instruction, have that too. That is identified, that instruction is identified in a document called an IEP, an Individualized Educational Plan. Laws require all schools that, yeah, I just did this. I'm sorry. Yes, you can move on to C, please. This is the process, and it's the same. It is the same everywhere. It doesn't matter what school division you're in. You identify a child who has a concern, you evaluate them, you determine if they're eligible for special education. If they are, an IEP is developed for them to provide that special education, and then they're reevaluated on a regular basis. Next slide, please. Sorry, you'll hear that now, overheads. Identification. This is child studies, child finds. It goes by lots of names. This is what teachers, whoever, can refer in the child, and there is a really, oh, I'm so sorry.
Okay.
Okay. All right. So this is, if I have to say anything in this whole process, this is where you need to be. If you have a child who is being referred for a child study, let's just call it that, you don't really know what's wrong yet, that's the meeting you need to be at, if at all possible, because you need to see if there's a health impact. If you go to that meeting and you find out the child's concerns are completely academic, there are no health concerns, everything is fine, you don't need to do anymore. But if there are health concerns involved, attention issues, some other type of physical disability, behavioral issues that may involve the need for some medication, you don't know, now you need to be involved and stay with this process. Okay, next step. Next slide, please. The team has to meet, review. They have a deadline of this first group has to meet in 10 days. The second group, we can go on to the next slide. Parent has to give permission, and all testing, and you can see it right there, psychological, educational, social history, hearing and vision screening, hearing screening for sure, vision if needed, and medical records, all 65 business days, not calendar days. Step 4, please. Now the team all gets together and they review all that information. Step 5, please. They find out if that child's eligible, and if they are, and there's a whole list of things they could be eligible for. Now they have to write a written plan that is legally binding. It is an important document and it has to be written within 30 calendar days following determination. You're not really a part of that unless there's some medical health pieces involved. Okay, next slide, please. 504 is a little different, you all. 504 doesn't necessarily involve specialized instruction at all. So it falls under the Americans with Disabilities Act. And what it does is it allows a child to have the same opportunities as every other child in that classroom to access the school day. So I'm going to give you a quick good example. Let's say you've got a child who's got a pacemaker in place. Has no problem learning at all, straight A kid. But they're going to have problems accessing some of that school day because they've got some limitations associated with their cardiac diagnosis. That's a child who's going to be eligible for come through our 504 eligibility and plan. Students with diabetes are automatic 504s. Students with seizures are all automatic 504s and maybe more, but students with diabetes are automatic go there. Those two go up more quickly than anybody else. And then it's all kinds of other things. Okay.
Severe allergies counts as that?
Kids that have EpiPens, their
Yep.
parents can refuse it, but their parents can also say, yes, I want that. And we put it in place. And it really protects them. 504 plans, 504 eligibility is lifelong. It's not just limited to the 12 grades of school and college. It's lifelong. So employees can have 504 plans in place in their work. Okay.
Because it's under the American with Disabilities Act. And
Yes.
what you will hear most commonly is that a 504 levels the playing field. That student has some sort of disability that impacts their ability to access the general curriculum. So what you're doing is putting accommodations in place to allow them to access the general educational curriculum.
So I'm going to give you a quick example. A student who has an IEP, that IEP is a lengthy document. It's 20 some pages easily. And in it, you will see 15 minutes a day inclusion with a teacher. It's very specialized instruction. They're working to improve reading. They're working to improve visual memory. A student with a 504 is going to have accommodations in place like frequent access to the bathroom, unlimited access to the bathroom all day, carries a water bottle all day.
Yep.
It may carry snacks with them in the classroom all day. I've just given you quick little ones. They're very specific accommodations that address that disability. A student with an IEP has very specific accommodations and services that address instruction. So it's instruction versus accommodating and getting through the school day and being able to access the entire school day. Okay, next slide, please. And I'm telling you all, this is really brief. It's much more detailed when we do it later on. The process, all I want you to see here is the process is identical. Next slide, please. It's identical to eligibility is eligibility, whether it's 504 or whether it's special ed. The only difference is you still have a child study meeting. Next slide, please. You still have a team that meets 10 days. Next slide, please. Anybody can refer, just like the other. Next slide, please. You have the meeting. Next slide, please. It's by the plan is once they're eligible, the plan's good for a year, just like it is with an IEP. They're good for 364 days. The only difference is with 504 eligibility, kids don't necessarily they don't go through all that testing. They don't do psychological and educational testing and social history. They bring doctor's reports. They bring psychologist reports. They bring psychiatrist reports. They bring that kind of medical documentation and recommendations in there. And that is used in addition to what the school wants to use to build their 504 plan. It's very detailed usually. Okay, next slide, please. Failure to comply, and this is important. Look at that first one. If we don't follow the IDEA, which is the Individuals with Disability
Education
Act, and then special education eligibility determination. My poor brain, I'm sorry. Federal funding, special ed federal funding, which can be significant, can get pulled. If somebody doesn't follow a section 504, all federal funding for the entire school division gets pulled. So these are not little things. These are big, important areas of education, and nurses play a greater role in them. And that's why we designate a specialized training just for this. This just gives you a very brief overview, and you are going to have some resources within the Padlet that will be helpful, that will show you that overview also. Okay. I think that might be, is there the next slide?
Yep. There you go. There's your
There we
stuff.
go.
So
And
if you,
that's the, our whole.
that's your stuff. Yeah. Do you want to, Leland, would you mind opening that, please?
Mhm.
Okay, that will, if we can scroll over.
Yeah, to the right. There it is.
There you go.
So if you
Special
click on that,
education.
this is an excellent document. This took all my very quick talking and broke it down for you. And you can see in there what is in blue is what the nurse does at that step of the process. So it gives, and this is pretty standard. You may have a little bit, you may have some wiggle room in your division with some of these things, but this is what the nurse's role can be at each step of the process. And so it's a good resource for you to take a look at. Okay.
Do you want to go through the pages or just?
I don't know how much time we have left.
Okay. We have 20 minutes. Yeah.
We have 20 minutes. Sure.
Mhm.
We can go through that a little bit if you don't mind.
Nope.
Okay, so remember, so if you start at the very top, and I'll probably go a little slower, you see the nurse's role in special education /504. So it doesn't matter which one of those processes, our roles change a little, but you'll see how this flows. There's always a child study. There's the referral reported to the child study chair, and there's a person, and it's usually could be a teacher in your building. It could be an assistant principal. There's somebody designated in your building that is in charge of child study, and almost always it's a resource teacher. Down from that, see the blue box? That's your job. You've got to gather some data that you're going to bring to that meeting or somehow submit to that meeting. Now, you'll see in there where I said complete child study health information worksheet. I have that, and that's going to be embedded in here somewhere. It is just a sample. It's what we developed a year or two ago in our division, and it works very well for us. But there may be parts of it that you want to adapt to use in your division. You all may already have something set up, but that's what we use to make sure that we are sharing all the information we need to share. Nurses are sharing all the health information about that child that we need to share at that child study meeting. And it includes things like vision, hearing, attendance, clinic visits, absenteeism, medical diagnoses, medications given or at school, parent input, what life is like at home, sleep, all kinds of things. And we bring that to the meeting to say, here are concerns, or here are issues, or here is everything is okay. This child doesn't have any health issues. Attendance is good, and grades we don't really speak to, but attendance is good and there are no health problems. And that helps that team in making a decision about now how to move to a next step. Then you have either a referral for evaluation for special ed, which is the 65-day deal, or they might say, we're just going to continue to watch this child for a while and see how he does. Maybe they're going to put some supports in place. The nurse may need to gather some additional health information at that time. Maybe the child's been referred to a psychiatrist, and the psychiatrist is going to evaluate them, and the nurse is going to need that report to see what the psychiatrist is going to do to handle this problem. If the child's being referred for special ed evaluation, again, the nurse may need to gather health information and submit it. Now, do you see in that blue box where I said limit information to what is needed? to determine eligibility. I'm going to tell you what that is. Sometimes you get these giant medical reports. The doctor's office just prints off everything. Nobody needs to know that information
Nope.
about that child. What they need to know is the child's diagnosis and plan of care, plan of treatment. They don't need to know a whole lot of other health information about them. So just because you get a big record that is 20 pages long, don't think that you need to submit that to anybody. You may want to keep it, but you only submit to this meeting the information that is needed for them. Okay.
And don't forget, that is part of your nursing license.
Yeah.
Is disclosing health information that to somebody who does not have a need to know.
Right. You can't do that. Now, see that next little blue box down, submit to Michelle Moss? Well, that doesn't apply to you because that's our person in charge. So
Yeah.
something that would have to be tweaked. Okay, now you go down, you scroll down a little bit, please, Leland, and now you have the initial eligibility meeting. First time this child's been into a meeting. There's where the oval is where the meeting has taken place. What does the nurse need to do? Does she need to attend it because there's health concerns? Does she not? And then you can just follow this. Is that child going to be eligible for a special ed services or 504? And then what has to be developed? And now if you scroll down to the next page, if he's eligible for a specialized instruction, SPED, now an IEP has to be developed. Well, does the nurse have to go to it? Does she have to continue? Well, sure, if there's health concerns. If there's no health concerns, end. She's finished. So that covers that part. And then if you scroll down some more, there is an initial, suppose a child's found eligible for a 504. Now here's the nurse's role. There's the 504 plan meeting. There's her role. And oh, I can't think of a time when there is a 504 plan to be developed that does not involve a nurse initially, because they have to do with physical or mental health disabilities. There's the rare exception of a kid who has a sensory processing disorder that may get in there. But other than that, the nurse needs to be involved in 504s from the get-go, because they're all health related, either physically or mentally health related. And then if you scroll down further, you see that every 3 years, these conditions have to be reviewed at least every 3 years. They can be reviewed every year if necessary. And so the nurse's role plays into there, whether she needs to continue to be a part of it or not. And then finally, we get down to the second document, which is, oh, we didn't fix that. Forget that 604, it's 504. We're gonna take that 6 out of there. That was our mistake on our end. See it up there? It says 5604 plan. It really is 504 plan. Now, I don't know if we can take it out.
Not unless you send it to me. And
I'll send it corrected. But this gives you a real nice differential between IDEA, which is specialized instruction, and section 504, which is accommodations. It's just very nice little reference sheet for you to use. So that's, and I think when we scroll down to that, that's the end of that.
Yep. It is.
So those are two resources that may be helpful to you. They should be, they're just resources to you. And I think that's where we are. And now we're back to you, Diane. And I thank you, and I hope you could understand me talking as fast as I did.
Oh, no, you're wonderful. Okay, so we're just going to go over some reminders of tidbits that you need to remember, since we have been throwing so much stuff at you. You are a nurse and a leader. You are a nursing professional in an educational environment. You are an independent practitioner. As Becky said, sometimes that's a little bit overwhelming, especially if you're coming from acute care, is that you're out there on your own. But remember, you have colleagues, you have supervisor, you have mentors, you have other people to reach out to ask questions. And you hear all the time, there is no such thing as a stupid question. There really isn't. And you could be told something 5 times, but it just goes flying out of your head. You as a nurse see students with a different set of eyes than a teacher or an administrator, because we tend to look at the student as a whole versus just the educational system. And school nursing is a nursing specialty. Next slide, please. Okay, what are some of the tidbits? Develop a strong relationship with your administrator. They can truly make or break you. As Becky said, you really want to make sure that you made friends with the office staff, because they are your backups generally. And you need to make sure that you are friends with them. And your school administrators, you may not like them, but develop that relationship with them. This is going to depend on the size of your school division as to whether or not you update your school board on nursing activities in your schools, nursing services, volume of visits, percentage of absences versus a return to class. And that statistically, nationally has been proven. If you have nurses in the school, the number of return to class with students is higher as well too. But if you're in a very large school division, they may not want you to be contacting you. Have a chain of command for addressing your school board. Participate in school activities. This is a big one. And Becky, I'm sure, is going to pitch in, faculty meetings and activities.
Oh, yeah.
A lot of times you can do your training there if you get invited to those, but you need to put yourself up too, because they tend to forget, as what did you call it? The gray zone?
Yeah.
Or green zone, because you're in between, you're a health professional, but you're in an educational setting. PTA, PTO meetings and activities, family nights. Families frequently love to get to know the school nurse, because if they don't have a child who has a health condition, they may not know you at all. School-sponsored events, again, like the mother-daughter, father-son, mother-son dances, if they have things like that. Next slide, please. Learn the educational language. Okay. And I have this, and a lot of people have never seen that, but if you would open that link, please. Because I come from public health as well too. This is excellent. It's actually been years, and it's a long thing, but we have this posted on there. But it's a great resource, and it teaches you, it goes through all of the educational lingo and ways to present yourself to your administration, because school nursing is a subset of public health. That's what you're doing. So this is another one. I suggest that you read this, and it does help, because you're getting to see what it is through the educator's eyes too. Because sometimes when you're doing in all of these classes and these meetings, 504s and IEPs, you've got a whole different language to learn, and it really does help. Okay, thank you. And the other thing, monthly bulletin boards. I know a lot of school nurses do this with updates and such like that, at least seasonal. Sponsor a student club if you have time. Faculty wellness activities. I've done that. And, I did a whole class on women's cardiac health too, and they loved it. Other things, Weight Watchers, BP screenings. Next slide, please. Yeah, we are trying to get through them. Be involved in your community. Chair or attend the school health advisory board if you have one that's doing that. Nursing coalition in your area. Get involved in the county events. Join the Medical Reserve Corps. Probably a lot of you already have too, because during COVID, that had been, Tracy had really encouraged that with contact tracing. I'm a Medical Reserve Corps member now. Since I retired, I couldn't be when I was public health, but you do a lot of extra stuff. Next one, please. Professional development, get involved in the professional organization. And we've already addressed that with the LPNs, because we know that. Keep learning. Professional conferences, the ASN usually has a fall conference. You don't know if that's going to be on this year or not. NASN has an annual conference. Take a class. Tracy has a bunch of stuff on the Padlet, on her side of the Padlet, that has some courses that you can take. And then she's always trying to send out things where we can do free courses, etc. This, of course, is always a good one. And let us know what you think, what you'd like to have for additional courses on. Go for an advanced degree or national certification. Next, please. Then we're just going to go through some of the school nursing resources. Next, please. Here we go. We got Tracy, and here are her credentials, her office phone, her email. And if you would open up the school health office one more time, please, Leland. This is everything that is on the VDOE website. And if you scroll down, it has pretty much everything. And down at, keep going down if you wouldn't mind. We have the medication training of school personnel. And then farther down, we've got some of the school health manuals and guidance. You've got the VDH guidelines for healthcare procedures in schools, which is outstanding. The 2017 one is out there. Just take your time to look through all of the stuff that's out there. The publications down there, you've got the communicable disease reference chart that VDH puts out, which is very helpful if you've got just, can we click on that one by any chance, Leland, under publications? Everybody should have this in their health room.
Yes.
Oh, never mind. We'll go back to it. But the first aid guide for school emergencies, that's the little flip thing.
Yeah.
Everybody should have that as well too, unless your school division has its own, which I know Fairfax and Arlington have their own, so. Okay. All right, next slide, please. And then we have Joanna Pitts, who is Tracy's counterpart at the Virginia Department of Health too. And oh, I didn't link that, I'm sorry. But this link actually will take you to the VA, Virginia Department of Health, the school forms and school nurses too. And I'll link that up later. Next slide, please. So there is those are the links for VASN and NASN as well too. And as Becky said, NASN does have quite a bit of free courses that you can take. Next slide. Publications. Again, this is all from the school health office. School nursing scope and standards of practice, the code of ethics, the school nursing comprehensive text, which is Janice Selectman, who we had at SISM 2 weeks ago, I guess. Yes. The first aid guide, the online resources from VDOE's health website, which is the school health office, which we went through. Next, please. And remember, be proud of your specialty. You're not just a school nurse, and you'll hear that, but you are the health and medical professional in your building. Okay. And yes. Questions, I know we have a lot, so we can go ahead and
let me say one thing first. The two special ed, not the child study worksheet, but the special ed document that I gave you that has the person's name on it, we're probably going to take that down off of the Padlet and let me get those documents created. So it may disappear for a while and then it'll come back up to you. So you'll have it as a resource to use. But I want to have that person's name off of there and that other little area cleaned up. And then we'll go from there. So I just want, so if it disappears, don't be worried. It'll come back.
Okay. So one of the questions is medication training for diabetes, glucagon, seizures, and diastat. are required to be done by an RN. This is the initial training or yearly training.
They're yearly.
It's yearly and it has to be done by an RN. That is part
Absolutely.
of the code of the Nurse Practice Act and the Code of Virginia. How do you get access to the 504 for lifelong after graduating from school? That is going to be the parents that they have access to it. Some colleges will take a 504 and some of them will just look at it and write in accommodations as needed. Who writes and develops the 504? This is an educational plan. You can help with it, but most of the time the nurses have an individual health plan. It might be attached to the 504, but
but I have to say, probably shouldn't be
yeah,
referenced in the clinic, and I'll say it's housed in the clinic, and I will say why.
Yeah.
You may update a 504, individualized health plan throughout the year, and
Yep.
every time you update it, if you have it attached to the 504, now they got to go back and update an addendum to the 504. So nurses are a part of the team, but who writes 504s and IEPs? 504s are written by the designee in that building. Oftentimes it's an administrator, believe it or not, it's an administrator with a resource teacher. And for IEPs, it's almost always the case manager for the student who is going to be a resource teacher.
Who's a specialty?
Their
Yes.
educational documents.
They are not ours.
Support. They're
Yes.
not health documents.
So who writes, do private schools have to provide accommodations to children with 504? If they receive federal funding?
Yeah.
Yes, not every private school does.
Correct.
When are we going to do the specialized training for the IEP, IHP? It's mostly IEP, it's going to be special ed, and we haven't, I think October, November is when we're looking at trying to do a more extensive one. And that's more because let's get you guys through the beginning of the year.
Right.
And
this is just to get you started now.
Yes.
And just a glimmer of it, but there's certainly, it needs to be fleshed out much more for you all. And that's, I just don't know when it's going to be. I think maybe the one.
And thank you. The Padlet info is there. Thank you, Cheryl, for answering that. It's in the chat box for the Padlet, and we will be adding stuff to that too. And I think we can try and see if we can get your email addresses. And as Tracy said, please make sure that you've added yourself or you've gotten into the listserv, because when stuff goes out, Tracy will do an email to the listserv, and then that way you will be getting a lot of the information, and then you'll have the Padlet, both of them, where you can go in and add.
Right.
You can go in and take a look at all of this too. Again, we tried to add stuff into the Padlet that would be what you need to know. It makes it as easy as possible on new school nurse orientation that you can go in and look at. You may have a lot of columns to look at now, but what I've tried to do is create more columns versus adding underneath all of them, so you had fewer places to go scroll through at this point.
It's a great idea.
Open to suggestions. Open to suggestions. Do we have any more? Yes, we have one more message. IHCP. Let me talk to Tracy. Yeah, there's a lot of information there. And NASN, if you go to their website, they have position statements on pretty much everything, including individual health plans, etc. Not give nebulizers related to COVID. That is going to be an individual school division at this point, but it is strongly discouraged by CDC guidelines right now because of the aerosol. It has to be more of an isolation place, but yeah, if there is a kid, I would check with your school division, because there are some
Right.
students that
Yeah.
have to have nebulizer treatments. And of course, we can say, are they coming back? But then there are a lot of school divisions that are requiring a medical exemption for the child to learn virtually this year. And again, the healthcare providers may not feel comfortable putting their license on the line saying that absolutely this child cannot attend school without a true pressing medical
Right.
case.
Because the expectation is all children. That's,
Yeah,
all children are to be in school. In school. There's
yes,
learning, but that is very limited. It is supposed to be limited. It's been legislated that children are to be in school. So
Mhm.
we want them
So
as best we can.
do we have any more questions? I commend you guys. This is not the best way to learn.
No,
And we would have loved to have had you in person, because we just thoroughly enjoy doing it. Get to know you personally, but I would also say we'll post our email addresses too. And
sure.
please, please, please feel free to email us. I'm putting mine in.
And be on the lookout for that 2.0 and that 3.0
Yes,
training for later this year, because that's when we're going to flesh out. I know one of them is going to be Medicaid billing. I know one of them is going to be special ed. And I'm not sure if there'll be one beyond that that will maybe cover a variety of topics. I don't know. But I do know about those two. I need to enter mine in here, and I have to stop and think where to put it.
yeah,
I don't have chat. How do I not have chat?
okay. Give me you want your work one?
Sure. So mine is long. RT as in Thomas Cooper.
Mhm.
And here we go at Shenandoah, SHENANDOAH
I know how to spell it. Yeah,
.K12 .va.us.
yeah. Here we go. Okay. Do we have any other questions at this time? Because I'm sure everybody is hungry. Okay. Nothing else. So we're letting you at 5 and
Hang on a minute. I want to say one last thing. Diane, did we cover, I'm just thinking in my brain, when we provide a short training for those staff in the school that give pills, medications when we're not in the clinic, like if it's the secretary.
And that is, please go ahead and look at the medication administration or the medication training for
Look at that.
unlicensed personnel. That
Look
is
at that.
on the Padlet. It's also on the school health office. Go
Right.
down there, and that has just been updated. I know, because I've worked on it. So that has been updated, and it's a long manual, but it's very, very thorough.
Yeah.
And that will help you immensely. And then I believe we also have Nancy Markley did a PowerPoint presentation on that you can use for training your school staff.
Right.
Do they like it? No, but it's
No.
thorough. And that's part of, if you tell them this is all part of Code of Virginia, then sometimes they swallow it a little bit better. Okay, anything else? Again, we look forward to hopefully seeing you guys again
Yeah.
in October, November, whatever time it is. We hope that you get the time to join the Zoom meetings. Had a lot of positive feedback for Tracy and Joanna on these, because they're informal, and you
Mhm.
can get questions answered as well too. And if nothing else, again, it's a place that we can direct you to go look at this site and this site. And it's not that we are, if we tell you to look at a site, it's not that we're saying we don't want to answer a question. It's just, again, especially as adult learners, if you have found it yourself and it's going to solidify in your brain where it is. Okay,
Sure.
so
Again,
again, thank you. And I would also like
working
to
with
say,
us.
yes.
Hope
And,
it was helpful.
and may I also say, Leland, you're awesome.
Yes.
If we can just tell Virginia Tech, they did a super job, and he has just been so very patient with all of us, with Becky and me, with being in 2 different places. She's in Shenandoah, I'm in Lake Monticello, and he's been running this, the PowerPoint for us. And he didn't find that out until late last night when we started having Zoom problems. But again, I hope everybody, yes. Are the 2 other sessions included, or do we need to sign up again? Probably you need to sign up again, because what you're going to get, the CNE hour, yes, you'll get 4 contact hours for this. You'll be getting your email very shortly. It's going to be just the same as for the other 2 days for CISN. You'll get that. And then when we have the additional hours too, that should be provided as well too. This will also be up on the website, but after tomorrow, they will not be providing contact hours. Okay. All right, everybody. Again, thank you so much. And
Thank you all.
we look forward to seeing you
Yes.
again.
All righty. Bye-bye.
Okay. Bye.